This is Supervisor Dave Baker, Chair of the Board of Supervisors. We'll convene our meeting Monday, October 12th, 2020, 9 a.m. And the meeting is being conducted by Zoom and also in person at the Dubuque County Courthouse Supervisors Chambers on 4th floor. At this time, I would ask everyone to rise and join me in reciting the Pledge of Allegiance. And I'm going to ask Ed Graber to get the flag up for us.
Dawn disabled my screen sharing this morning, which is unusual, but I've emailed that image to Dawn, and I'm sure that in just a moment, Chair Baker, Dawn will do that.
Okay, thank you. I pledge allegiance to the flag
of the
United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, we'll go to the agenda. First thing on the agenda would be public comments. At this time, anyone may address the board on matters which are on the agenda. Please, if you're in the courthouse, go to the podium, state your name and home address, or the same thing applies on Zoom. You can raise your hand on Zoom or send us a message in chat if you would like to speak in public comments on items which are on the agenda. Okay, I'm not seeing.
Baker?
Yes.
Just a point of clarification. I will be departing the meeting at 9:30 to attend a funeral today, so I will not be available past 9:30.
Okay, yeah, understand. And publicly, our condolences on the passing of your Aunt Helen. Okay, we will move into the agenda then. We have item number 2, approval of the minutes of the meetings of September 28th and October 5th, 2020.
I will make a motion to approve the minutes of September 28th and October 5th.
Second.
Motion made and seconded to approve the minutes. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. Number 3 on the agenda, consent items. The following items will be acted upon by a single motion without separate discussion unless a supervisor requests that a specific item be considered separately. So the first item is LC liquor license for Roadies Double J LLC. That's item A. So I would suggest that we tackle that first.
I'll make a motion to approve the consent items for the liquor license for Roadies Double J.
Second.
Okay, motion made and second. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. Item B, and I believe we can take these together unless somebody wants to talk about them separately. We have different reports, third quarter report from the auditor's office, third quarter report from the recorder's office, third quarter report from the sheriff's office, and third quarter report from Resources Unite for our general assistance program.
I would like to I would like to pull the report from Resources Unite.
Okay. And I was going to point out that we do have a work session on that one as well, but let's go with the first three then. So we've got the reports from the auditors, recorders, and sheriff's office. What's your pleasure?
Motion to approve.
And I will second that.
Okay, motion made and seconded to approve the third quarter reports. All in favor signify by saying aye.
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 Carried 3-0. All right, then we got the third quarter report from Resources Unite.
Motion to table.
I'll second that.
Motion made and seconded to table. Any discussion? In discussion, as I already pointed out, we have a work session scheduled on this topic. Let's see here. At 11:45 a.m. Okay, all in favor of the motion signify by saying aye.
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 Motion is tabled. Motion's carried. Okay, next up, we have procurement procedures. The one and only item is to approve notice to bidders for network security equipment. We have
Was this in our budget?
Nathan Gilmore on, I'm hoping.
Good morning, all.
Good morning, Nathan. You give us an update. I know this is a notice to bidders.
Certainly. This is a capital project back from the previous budget cycle to replace all of the small firewalls that are spread around the county. The original ones were purchased in early 2015. They are now end of life and off of support, which is not a good place to be. So this is to replace them with newer versions of themselves for another 5-year cycle of support on these. They're all over the county. Farley Shop, Swiss Valley Nature Center. That's how we connect most of these off-site locations back to the courthouse.
Okay. And this is the notice to bidders.
Motion
Yes.
to approve the notice to bidders.
And I will second that.
Motion made and seconded to approve the notice to bidders for network security equipment. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. Item
Thank you.
5. Yeah, you're welcome. Thank you. Item 5, public hearings. Don't believe we have any today. So we'll go to item 6, approval of plats. We have a resolution approving preliminary plat, Derby Grange subdivision number 5. And I would go to Tammy Henry, our zoning administrator.
Good morning, everybody.
Good morning, Tammy.
This property is owned by Ronald and Mary Breitbach, and it is located 0.31 miles west of the city of Dubuque along Herod Lane, with a total of 14.50 acres surveyed. This property is zoned R3 single family residential. There was a previous rezoning of this property on zoning case number 1221 of 93 from A1 agricultural to R3 single family residential. The purpose of this plat is to create a residential subdivision. The survey creates 5 lots. Lot 1 through Lot 4 are all a minimum of 1 acre in size and will continue to be used as a golf course until the lots are sold for residential homes. Lot 5 is 9.90 acres with a barn and a pavilion, and it will also continue to be used as a golf course with plans for a future home for Ronald and Mary Breitbach. Each lot shall have its own individual septic system, and lots 1 through 5 will receive water from the same public water system that serves the Derby Grange Clubhouse. Lot 1 and Lot 2 will share an approved residential entrance, number 20-14 off of Herod Lane, and Lot 3 will use an approved residential entrance, number 20-13 off of Herod Lane, and Lot 4 and 5 will share an approved residential entrance, number 20-12 off of Herod Lane. There will be a 15-foot public utility easement for lots 1 through lots 5 that runs along Herod Lane. Lots 4 and lots 5 will drain into an existing sediment basin that is currently retaining water. Lots 4 and 5 currently drain into this basin and will continue to do so after grading is completed. Based on the stormwater calculations, this basin is large enough to handle the Dubuque County stormwater quality standards peak flows for lots 4 and 5. After lots 1, 2, and 3 are developed, a secondary retention basin will be built as identified in the final plat. The water quality volume standard for the Dubuque County will be met. Infiltration of 1.25 rain event by using soil quality restoration. All stormwater improvements, including the SQR, will be the responsibility of the developer, Ron Breitbach. So you've seen the first version of this when you started talking about the entrances. So now this is the preliminary plat, and we'll have a final plat approaching you yet. But there hasn't been any changes, and we're not expecting any changes to this. And I know that Dave Schneider is on, if you have any questions for him, as well as Mr. Breitbach.
Dave Schneider, do you have anything to offer, or Mr. Breitbach?
All right, I can. Oops, are you there, Ron?
Yeah, no additional comments. Go ahead, Dave.
Okay, yeah, we'd be happy to answer anything, but basically Ron is developing this thing kind of for his family, I guess, and trying to just work his way with the golf course. Is going to try to maintain it as long as possible or just scale it back to accommodate the lots that are being created. This thing is within the 2-mile jurisdiction of the city of Dubuque. We have taken the final plat through there already. We're out a little bit ahead of that on the planning and zoning side at the county level, as well as taking that to the city, and they've approved that. So pretty consistent with what's going on right across the street. We're just kind of expanding the 1-acre residential lots across Herod Lane. If you have any questions, we'd be happy to answer them.
Question for either you, David, or Mr. Breitbach. Have you been working with Eric Schmechel from Dubuque County regarding stormwater runoff? And I know there's a reference to the ponds. I want to make sure that Eric Schmechel has been involved in this. I believe he has. I just wanted to hear it from you.
That is correct, Dave. Eric has been reviewing the calculations done by Matt Schock with STS Civil out of Marion, making sure we satisfy the Dubuque County stormwater requirements.
Okay, thank you. Okay, any other questions for Mr. Breitbach or Dave Schneider?
Make a motion to approve the preliminary plat.
I will second that.
Motion made and seconded to approve the resolution approving the preliminary plat for Dubuque Grange subdivision number 5. Okay, any further discussion? All in favor signify by saying aye.
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 Carried 3-0.
Thank you.
You're welcome. Thank you. All right. Item number 7, action items. The board may approve, deny, or table any action item. First up, resolution for appointment of deputies, assistants, and clerks. And we would go to Dawn Sherman, our Human Resources Director.
Good morning. These again are 2 vacancies, and one in the treasurer's office and a CNA up at Sunnycrest. And so you have approved these requisitions, and I recommend approval.
Okay.
I will make a motion to approve the resolution for the appointment of deputies, assistants, and clerks as presented.
Second.
Motion has been made and seconded. Any questions or discussion? All in favor signify by saying aye.
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 Carried 3-0. Okay, next up under item 7 action items is a resolution to approve necessary documents with Horseville Construction Incorporated for the PCC pavement grade and new on Cox Springs Road, project LOST-2003-73 2021-31. For this, we would go to our county engineer, Anthony Bargett.
Okay, thank you. I have the contract in front of you guys here for approval. I've reviewed it and everything looks good. It would have a late start date of August 9th, 2021, with 50 working days, and very pleased with the price we got on this project. Probably I don't really anticipate a whole lot of work being done the rest of this year with the weather getting cooler. So this would probably be a spring start date, I'm assuming.
Okay, thank you, Anthony. Any questions for Anthony? Not a motion would be in order.
Make a motion to approve the resolution.
And I will second that.
Motion made and seconded to approve the resolution. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. All right, next up is consideration and possible action on programming of county land stewardship funds. Is this Eric?
Yeah.
Okay.
Yes. Good morning.
Good morning.
Thanks
Hey,
for the
Eric.
time this morning. Wanted to chat and really get feedback. I believe Ed Raber had sent a memo out last week in regards to the couple of different presentations that we've heard recently from the Soil and Water Outcome Fund, as well as the Land O'Lakes and the Chutera LLC project. Discussed with Soil and Water Commissioners, have also discussed with Ed back and forth, looking back at the $390,000 that was allocated for, we started, calling it the Project Implementation Fund, but Ed came up with the Land Stewardship Funding idea, and I did like the title of the Land Stewardship Fund. I think you've heard me talk in the past about trying to pilot a few different scenarios to, as we get our watershed working group developed, as we, start the new 2080 agreement and build this new watershed program, believe piloting a couple different funding mechanisms for farmers, looking at a pay for performance approach in general as kind of the foundation for all of the pilots, but also maintaining flexibility in programming, and also thinking about maybe some non-traditional type of funding that could be available for farmers compared to your traditional funding of state and federal programs, which we will still utilize when feasible. But essentially have looked at Soil and Water Outcome Fund. I was impressed with Adam Keel and Mark Lambert out of the Soybean Association and Reharvest, and what they're building and doing. It's a very much pay for performance type program. I think you guys have saw that in their presentation. As they enter the second year of a goal of 100,000 additional acres from their 10,000 original acres. I felt like that program was well run. It also gave, although we are hiring an agronomist in Dubuque County, I think it also enables a stronger partnership with the Soybean Association, their research team, the facilitation process, the contracting process, and I think the outcomes that we've heard from farmers has been very positive in that program. So that one, was recommended $250,000 in funding there. Second program that we heard from 2 weeks ago was the Chutera program, which is, as you guys know, is more of a land stewardship based program. And I think we'd be the first county in the Midwest to try and fund and back the Insight Engine and how that would work. And I think it's really important to start building collaboration with our ag retail so that farmers are receiving a more consistent message versus your conservation minded folks and profitability in the ag retail section. I think it's one of the barriers that trying to break through is to collaborate together with ag retail, and I think the Insight Engine does that. I think it gives us an ability to work with them, and then also allows for really a lot of flexibility for farmers to choose how they can get a higher sustainability index score. Thirdly was the thing that I have kicked around and I really talked about, you know, the buffering program, existing CRP programs from a state and federal level at the February work session. How do we encourage more landowners to install buffers, waterways, and in general, taking out highly erodible lands, HEL ground, out of production and getting that land and set aside in CRP and prairie, looking at all the different benefits that has to that. So in general, we came up with more of an eco-services fund or contract that would be developed by Dubuque County with landowners, essentially looking at paying for environmental outcomes of CRP prairie projects, taking land out of production and looking at how we would enroll that land into an eco-services fund that would be in addition to a CRP payment to that farmer. So that's probably the least out of the three different main funding mechanisms that we've heard from. I haven't proposed a contract yet. This is an idea that we've been kind of discussing the last 2 weeks with the city of Dubuque, Dubuque County, and others in the Dubuque area. So really today I was hoping to get a recommendation discussion so that at our next meeting we could bring a resolution to you with the funding allocations out of the 390,000 that's been allocated back in February. So I'll pause there and open it up for discussion.
Questions for Eric Schmechel?
I'm going to defer to Supervisor Wickham. I think it's unfortunate that it's, you know, it's not anything we can do about this, but I know Supervisor Wickham needs to leave. So there might be a purpose to having a more full-throated discussion about this. And that's going to definitely, Jay, if you want to add anything at this time, but I'm not in any way interested in taking action on this today.
Sure, and I appreciate that opportunity. I had responded to the email, I think that Eric had sent out maybe a week or so ago. And so generally speaking, I'm pretty pleased with the mix of the different programs that we have. My only recommendation was relatively, I would say a strong one, was to shift $100,000 from the soil and water outcome funds directly to what we're calling the eco-services fund. So you'd have $130,000 in that fund or initiative and have $150,000 in the soil and water outcomes fund. And my vantage point was that that would allow us in what's called the eco-services fund to do more edge of field work related to buffer strips, related to other structural programs they might put in, whether they be retention basins, those types of things, and then CRP type of additions, which I think are very valuable. And those all would be local and they would all be individually controlled by the partnership group. Whereas the soil and water outcome funds and the Trutera programs are very good programs, but they are structured by those two entities. And so that's the rest of the mix I like. And I just would have a little change in the appropriations so that we have more local dollars in some of those eco-services funds.
I guess from my perspective, you know, the land stewardship language and, you know, brushing this with that language is, I felt a little bit like I was being reschooled in what I thought we were trying to do when we did all this in the early spring. This money was for implementation, and I think we need to stay true to that. That isn't to say that this year in 2020, everything being different than we thought it might be, that I'm not against in any way different funding allocation, but I don't particularly care for the introductory memo to brush this as somehow we had a stewardship plan idea, because we really didn't. We were taking Houston Engineering and we were looking at putting in as much money as we felt the county could afford at that time to put implementation dollars into projects that were going to be the result of some science that was from Houston Engineering. So in that regard, I support what Supervisor Wickham is saying, which is shifting more money to looking at what we've now called eco services. And I understand we got to come up with terms as we go along, but I don't want to have our, I don't think we should ever readdress how we talked about it with voters and citizens when we levied their funding. And that was for our implementation, and to be sure we have an accurate portrayal of why this year we couldn't do it that way. And that's the same reason, I guess, for what it's worth, I have issue in the discussion with the idea that the last paragraph, when considered over the entire 7-year period, we would be putting in $2,730,000. Yeah, no, we didn't agree to that. This was an initial implementation dollar funding, and there was no idea, not to say that that might not be where I want to go, but we didn't have year 1 of 7 of funding at just about $400,000. So again, I just don't like the characterization of how this is, because it's like us, you know, revisionists sitting here now and saying, well, that couldn't happen, so how do we shift the funds otherwise? I think we should be direct. We couldn't get all this done, but we have still a philosophy. We want to take some action. On the issue, on the True Terra program, I'm not interested in paying them a 10% fee. I'm not. And the gentleman, when he was with us, seemed that if we made that request up his chain of command, we might get a different solution. When you're first, I don't think you pay your way. Obviously, they have expenses, but it's in their best interest if they want to grow this to work with us as well. 10% just seems kind of arbitrary. I don't know if anybody came up or had a further discussion with those folks. So those are my rapid fire responses. And I appreciate that we are attempting to do something. I think that's very important. But I would also, I guess, to take consensus away today, I would move some of that funding also into eco services so that we have more implementation dollars should we find the ability to, you know, to identify folks who do want some help with doing buffer strips and so forth. And I'd like to have an update at some time with you, from you, Eric, with the hiring of these additional staff people. You know, that to me, that goes hand in hand with if we're going to let go of some of our implementation dollars directly through some folks that we might be hiring. I'd like to know where we are with that as part of an action update.
Yeah, maybe my last comment will be before I go, and those are good points. I generally agree with the, you know, some of the discussion there with Supervisor McDonough. You know, my understanding would be, you know, today, if we can continue to set high level kind of goals and or buckets, we would have an opportunity to review contracts with the Soil and Water Outcomes Fund, and we review contracts related to True Terra as well. And I think those are good points where we talk about some of those, you know, commission fees, for example, that we could either remove or add those and be comfortable with those. And then at the end of the day, if we're not able to, the board, that is, sign or, you know, pass a resolution to sign the Soil and Wild Outcome Funds, it doesn't get signed and it doesn't get implemented. And so, you know, for today, if we can just kind of generally, I think, agree, here's where we are today, and then the next level have staff, Eric and Ed and others, come back to the partner group with more details. We can take shots at those each and every time. Related to the funding for the 7 years, you know, I think in the 2080 we are generally committing to funding staffing levels, which I don't remember off the top of my head, but are hundreds of thousands of dollars. My comment generally would be, don't do that if you don't plan to have project funds available to implement. We don't need people if we're not going to have implementation dollars. So I think I would encourage my colleagues to understand that this is a longer term thing. And while $400,000 may seem like a lot or may seem like a very small amount, it is needed dollars to make some minor changes and to, you know, establish some consistencies and establish just at least a program that we have to improve our quality of our water and also the flooding issues and ultimately the soil outcomes as well.
I would
thank you for all the work so far in the comments.
Yeah, I agree, Supervisor Wickham. I just don't want it to be somehow in the minutes that we've agreed to march forward this way, because we haven't.
Yeah, I don't think I am not agreeing to 2 point, whatever it is, $8 million. So that is, I don't think that's our resolution or purpose. But I think it's okay to say, hey, here's the future, and we have appropriated $390,000, and now we're trying to figure out how those buckets should be established, and then the next level will be a contract to actually sign those, and Eric and his staff will continue to roll through the procedures that we're establishing for this time. Right now we just threw out a $970,000 contract for a road. Why was that easy? Well, we've been doing that for 100+ years. This is new, and so it's going to take a little time to get some of the documents and the details in place. With that, I will excuse myself. Thank you all for your work, and we shall see you in the future.
Thank you, Supervisor Wickham. So Supervisor McDonough, it sounds like maybe tabling this seems to be the consensus for today.
I don't think there's any proposed action before us today.
Okay, all right. It is under action items. It says consideration and possible action. So I would say a motion to table would probably be in order based on our discussions.
Motion to table.
And I will second that. Any further discussion? All in favor signify by saying aye.
Aye.
Aye. Okay, we'll table that, and we'll have to get with Eric and perhaps set up another work session to work on some of those additional details. All right, moving on, under action items, we have 2 duplicate warrants, one from Midwest Bank, one for $324.21, and the other for Ben Minger, $70.02. I will make a motion to approve the duplicate warrants as requested.
I was just looking to see if it's a resolution form. What is it? It's 2 emails. So I would second that.
Okay. Motion made and seconded. And for the public, for people that are listening, a duplicate warrant is a check that got sent previously that was approved, and the recipient either did not receive it or lost it. And these are replacements. So
it's just coming to us through email. It's just emails that are submitted to us on our document packet. So,
right.
Okay.
Okay. All in favor signify by saying aye.
Aye.
Aye. Carried 2-0. All right. We're moving into communications. This is correspondence that the board will receive and file without taking action. Item A, 8A, letter from the county attorney regarding a home-based business permit. It's in the packet, and I will move to receive and file. Motion dies for lack of a second.
Motion to table for action item. I'd like to have conversation with Tammy Henry, the zoning administrator.
Okay, so your motion is to table.
Yes.
Okay, I'll second that. All in favor of the motion to table signify by saying aye.
Aye.
Aye, carried 2-0. All right, next up we have under B, 8B, we have a number of items. We have a manure management plan for Duschner Dairy number 63444. We can do these as a group or individually, I believe.
Make a motion to receive and file the items identified in the communication sub B.
Okay, and I will read those just for the record. I will second that, Ann. So I already mentioned the Duschner Dairy Manure Management Plan. We have proof of publication amendment to zoning for Brown case. Proof of publication amendment to zoning for the Nickel, Nickol case. Proof of publication amendment to zoning for the Kramer case, Kremer. Proof of publication amendment to zoning Steffensmeyer. And proof of publication amendment to zoning Remical. So any discussion? All in favor to receive and file signify by saying aye.
Aye.
Aye. Carried 2-0. The next item is a letter from the City of Worthington regarding urban renewal plan amendment.
Motion to receive and file.
And I will second it. Any discussion? All in favor signify by saying aye.
Aye.
Aye. Carried 2-0. So we have appointments, item 9A. We have appointments on the Investment Policy Committee, item number 1. And I believe our County Treasurer, Eric Stearman, may have a few words on this.
My question to the treasurer and to Ed Raver, who produced a memorandum for us, is what is the purpose of the committee?
Well, to give you some history on the investment committee there, it goes back to the Iowa Trust, which was in the early 90s. And the Board of Supervisors at that time, and that was before my time, the Board of Supervisors selected, they wanted a committee in place, and we get together 2 times a year. We get together in March and September, and they just basically take a look at what we're currently doing with the money. Are you guys familiar with the Iowa Trust at all?
I recall
The Iowa Trust.
Yeah.
The Iowa Trust was where some money was stolen, you know, based on investments there. So, and that was in the early 90s. With all the money ended up getting recovered. So it's kind of like keep an eye on where our investments are at. So that's the idea behind the committee. So we have 3 individuals. We have a gal from Farley, a gentleman from Bernard, and we currently have an opening. You know, I was looking for I believe Joyce is the one that's up for renewal here for approval of that. And there's a gentleman that just retired from DB&T, and he has indicated interest that he would be interested in serving on it. So, but that's, do you need more detail on that?
No, but I did ask that this be tabled so we could get these questions answered. I think it's a vital committee when, you know, especially as you just expounded, you know, and informed us its purpose. And I don't like to see that we have vacancies, and that also some of individuals, perhaps Mr. Lynch has been on this committee since its inception. You know, if there's purpose to keeping this fresh and not trying to tell you your business, obviously, Eric, but, you know, not having vacancies and maybe even having more than one application for us to consider. So, because I don't want it to just be understood that, oh, we just kind of do this. It has a critical role for us. And that would be the purpose, I think, that it was created those many years ago, as you said.
Yeah. I don't believe Jerry's been on it since the inception of it. He came along at some point, but I don't. Yeah, but I get your point there. I understand that, and we are, you know, but when you have people on the committee, you need, you know, you offer to have them renew or not renew, and if they like to renew, you know, and they're kind enough to want to support it, you know, you hate to say, well, we don't want you, you know.
Right. No, this goes to overall all of the committees and commissions in the county, you know,
Sure.
purpose and what, you know, training and what are we offering these individuals? Are there stipends to attend meetings? Just a whole way of looking at the, you know, the vibrancy of the county doing its business should be through some of the committee and commission work. And you know, we're faced with so many vacancies throughout this. So it's just all, and again, just to raise questions about the necessary work of all of the committees and commissions.
No, I understand. That's a good point.
Okay, what we're dealing with today on the agenda is the application of Joyce Jardine, who was on the, has been on the committee and has agreed that she would reapply. So I'm looking for either a motion to approve or a motion to table, I guess.
Hey, Dave, just a comment on Joyce, since she's the one that's up there. Joyce has been a valuable part of our committee. She was a member of the Farley City Council. She asks a number of questions. She's interested in she knows why we have it, and she's interested in that, and she does keep an eye on what we're doing. So, you know, and I'm not saying anything about anybody else. She's a valuable member of our committee, though.
Correct. I don't disagree. I am pleased to see her and have you know, met her and am familiar. She's no longer on the Farley City Council, but she's always
right.
questions there as well. But, you know, we have they show us 2 vacancies. So if she is a renewal, I don't see that before me here. But maybe, you know, Dawn would know if she is a renewal. Well, obviously, Eric, you know, if you've worked with her before on this.
Well, sure. I think what happens here is it's not a breakdown as much as, you know, that we meet twice a year, and then and perhaps it should be me keeping an eye on these vacancies as they come up or on their renewals, because of the fact that you know, we kind of sent out and says, oh, do you want to remain on it? I understand now that you're off the committee because you didn't apply for, you know, for re-upping there. Right. And so that would be my problem for not staying on it. I'm just calling, you know, I'm contacting those people every 6 months and having them come in and not noting whether they're currently on the agenda or on the group or not. So, right. And I know the personnel office has a lot more things to do than keep an eye on Eric as far as which individuals need to be renewed or not. So I'll keep a closer eye on that.
Eric, actually, I intend to have our office staff do that as well, because it's central to what we do. And as you say, this committee itself, I think several folks looking out to make sure that we have this committee functioning is in the taxpayers' best interest. But
you're right.
Yeah, I'll make a motion to approve the appointment of Joyce Jardine to the Investment Policy Committee.
I will second it.
Thank you, guys.
Yeah, thank you.
Have a great day.
Thank you.
Any further discussion? All in favor signify by saying aye.
Aye.
Aye. Carried 2-0. All right. Next up is 9B, and it's Watershed 28E Working Group. I would assume we're going back to Eric Schmechel.
Motion to table.
Yeah.
Okay. Yeah, based on our previous discussion.
Tabling probably makes sense, again, with Supervisor Wickham not being here.
Okay, motion to table, I'll second it. Any discussion? All in favor signify by saying aye.
Aye.
Aye, carried, it is tabled. All right, we have we have open vacancies.
We have no report.
We have no report, okay. All right, item 10, personnel requisitions. This is the one I was looking for. Maintenance with the Sheriff's Department, and we'll go to Dawn Sherman for this, and possibly Sheriff Kennedy.
Yep, actually, this is Dawn Sherman. We'll ask that this be tabled. We do have a work session scheduled at 11:30 today that the sheriff has requested, so he can discuss this with you. So we're just asking to table it to the work session where you can take action at that time.
Motion to table.
Second. Any discussion? All in favor signify by saying aye.
Aye.
Aye. Carried 2-0. Okay, tabled and pending items. We do have some that we tabled today, but I don't think we have any carried over items that have been tabled. So we'll go to the next item, public comments. At this time, anyone may address the board on matters which are of concern to that person. and which are not agenda items. Please go to the podium, or in this case, raise your hand on Zoom or send a message on chat, and state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. So we will open up for public comments if anyone is interested on something that was not on the agenda. And I do see Paul has his hand up. If we could unmute Paul Uzel.
I think I am already unmuted, but that's all right.
Okay, Paul, go ahead.
61 North Algona in town here in Dubuque. I forwarded, I have been very much in favor of a countywide mask mandate, even before the city passed a mandate. I have been in for a statewide mandate, but there seem to be a lot of people who don't understand the seriousness of COVID. But if you look at the numbers, especially lately, just in the last couple of weeks, we've gone from our new cases being in the 20s to our new cases being in the 70s, 80s, and a few times over 100. This is not getting better, folks. This is getting worse, and we still have the bulk of the flu season to come. I understand, number one, I understand the necessity to act quickly on this. I don't think this can wait 2 weeks and assemble all kinds of opportunities for input. I know the people out in the county don't want to wear it. I know the people at the sheriff's office in Wisconsin, in Grant County, doesn't want to enforce their statewide mandate. I know that Joe Davies County has been dropped off of the list of counties that have to have a mandate. This is wrong. This is headed in the wrong direction. And we need to have a mandate to secure the county, because that's where it's all coming from. You look at the numbers, the city's doing better. So I would ask that the county, all three of you, have a special meeting and make the mandate a part of that as an emergency meeting, because it's an emergency issue. And I'd enjoy some responses from you too.
We're really not allowed to engage in the public comments.
Oh, okay.
Yeah, it's. I think I read that. But certainly it could be an item that we schedule a work session or meeting for to discuss. That way the public knows that we're going to be discussing it. So
okay, I understood, but it needs to be as soon as possible. It can't wait 2 weeks.
Right. In the name of transparency, that these rules are there.
Sure. Okay. But it needs to be a lot sooner than 2 weeks.
I understand your opinion. Thank you. Okay. Any other public comments?
We do have another individual in chat. Pat Murphy is asking to speak to everyone.
Okay, let's make sure that Pat Murphy is unmuted.
Yes, my name is Terry Murphy, actually. I'm just using my husband's computer, so I apologize for that. But can I be recognized to speak in public session? Or
sure.
Public?
Terry, just give your name and address, please, for the record.
Terry Murphy, and I live at 155 North Grand View, Dubuque. And I'm a 40-year nurse, and I have kind of served in the on an infection control committee in a hospital some years ago. And it gives me a little bit of basis, and I'm certainly not an expert in COVID-19 at all, but I have currently, at least up until Thursday, was an employee, well, Friday morning, an employee of Sunnycrest, and I'm not quite sure of my employment status at this point. But I would like to address and inform the board regarding some concerns that I have COVID related at Sunnycrest. And I just want to elicit the help of the board in these issues. And there are kind of 4 categories, and this is not going to take real long, but it's PPE, staffing, improving and assessing our current infection control practices and improving communication within the facility. And I think this is kind of the perfect time to address those issues because we're in kind of a state of transition with administrators. And, you know, I think we always need to work for constant process improvement. And nobody a year ago could kind of anticipate COVID-19 in our lives. And so when it hit, everybody's kind of in a reactionary mode. And I want to try and see if we can't, you know, possibly get ahead of that and get into more, you know, that we're in a proactive stance. And so addressing the PPE, I think we need to fit test all the Sunnycrest staff and provide like N95 respirator masks, if possible, to everyone in the unit. I think as far as staffing level goes, I'd like to see, I'd first off like to give kudos to the staff and the residents at Sunnycrest. And the Sunnycrest family has gone above and beyond, you know, what's normally anticipated. They have really done some heroic things, in my humble opinion. I think we need to try and return to the previous staffing levels that Sunnycrest once had, recognizing, the board did a great job, I think, in recognizing and bringing the salaries up to date, therefore that hopefully in the future here we'll be able to, you know, hire more nurses, and I know they have hired some nurses, but we're still not full staff. And I was really, you know, excited to see that they had, you know, hired some, you know, traveling nurses, or they're going to hire temporary nurses. I saw that in the paper. The current staff has been working tirelessly and putting in a lot of volunteer hours as well as mandate hours. You know, that's pretty much on a daily basis. And some are working 60, 70 hours a week. The reason I bring that up is when the staff is working that hard on short notice and shifting departments and stuff, that creates stress. Stress can kind of wear down the immune system when you're going that hard. And I don't want that to, you know, the stress and the constant workload, you know, to make the staff more, you know, it affects their immune system and make them more susceptible to COVID-19. Like, again, I'm very happy that the board signed a contract for temporary staffing agency. And I think we need to get those nurses and CNAs on board immediately. And, you know, really, I am not understanding of what the contract was that was signed, so I don't know, you know, how they were intended on being used. We certainly need to use them, you know, I believe, in staffing the COVID and the isolation units, and or, you know, if we don't have active cases, you know, at the time, then maybe they can work to give, you know, a breather, you know, bring them in anyways ahead of time so they're familiar with the institution. So when needed, you know, and when they get here, they can, or when COVID, if it raises its ugly head, they're ready to go. And in the meantime, you know, they can help give current staff a little bit of breather to catch their breath and rejuvenate. And so with the 100, I mean, we're currently in a spike. We've got 1,635 active infections in Dubuque, according to the paper today, and the projections are only for that skyrocketing. And I'd like to think that we'd be immune from any further cases at Sunnycrest, but I don't know that that's going to happen. So we need to be in front of it, prepared. And that brings me to another thing. I think, you know, our staff need to know how the infection control decisions are being made, what the criteria are, and what it is being used to move COVID positive residents out of the COVID or isolation 3 unit. Are they using 2 negative tests, or are they using 10 days and symptom free? Or, you know, this should be announced with each, you know, with each resident as they're coming out of the isolation unit and passed on per shift. I think we need to improve on communication on that. I also think we need to look at the process, how and where the isolation units are being set up. I believe that initially the isolation units on first floor, it was better there because it was removed from the general resident population. They've recently moved one up that's kind of an extension of a general patient resident population. It's on the end of that floor. And there's a plastic wall between, and they're having nurses go from one area to the other, gowning up, gowning down, put on. I just think there's a risk of when you open that air up, you know, if it is airborne or whether it's droplet, no matter what, I think there's a risk of that going back and forth.
Hey, Terry Baker, I'm going to have to ask you to wrap up. Usually have a 3 minute limit.
Yeah, I've only got one suggestion left, so we're on point. My suggestion was I'd also like staff to have copies of their test results. And then, you know, maybe suggestion of having a consult of someone with an infection control background, a current one, kind of review the existing process with recommendations and, you know, check to see what other nursing homes are doing. You know, let's try and get best practice. And this is all, you know, constant quality improvement and trying to move forward. And with that, I respectfully close and I thank you for your time.
Thank you, Terry. Okay. Is there anyone else to speak under public comments? I don't see anything else on chat. I don't see any hands raised. So we will move. I'm going to ask for, we're about 4 minutes away from our next work session. I'm going to ask for a short recess, and we may start a couple minutes after 10. Just need a necessity break. So I'm asking for a motion to recess.
Motion to recess until 10:05.
And I second that. All in favor signify by saying aye.
Aye.
Aye. Okay, we're in recess till 10:05. Okay, Supervisor Baker here. We're reconvene the meeting. This will be the 10 a.m. work session to discuss COVID-related issues. So with that, we'll go to Patrice Lambert, our director of our health department. Patrice, we'll turn it over to you.
Thank you. Can you hear me okay?
I can hear you just fine. Thank you.
Okay, thank you very much. Well, good morning, everyone. I am just going to start by giving a quick update of our latest counts for Dubuque County. So in Dubuque County, we've now had 32,955 individuals tested. Out of that number, we've had 4,174 individuals that tested positive. Out of that number, we've had 2,478 individuals that have recovered. And unfortunately, we are at 48 deaths in the Dubuque County. Our positivity rate, the past 14-day average for Dubuque County, is now 14.2%. Out of all of our positive cases in Dubuque County, we are still seeing 47% of the that population in that 18 to 40-year-old range, followed by our 41 to 60-year-old range. We continue to have the two long-term care outbreaks, Mercy One Dyersville Senior Care. They have had 20 positive cases, and 7 of those residents have recovered. And I know Chris will give an update on the Sunnycrest Manor with the 17 positive cases, and according to the dashboard, 14 have recovered from that. Still looking at our hospitalizations, it was posted still with a number from Saturday, which is 23. And let's see here, I think that's pretty much with our dashboard update. Now, Samantha did prepare. If Dawn, you can share her screen with Samantha. We did prepare an update with our zip codes. We'll just see if Dawn can do that with Samantha. And while we're waiting for that to occur, I can also inform you that Stacy Killian was not able to participate in this meeting today. Okay, there's the slide presentation. Okay, as you're aware, we do receive the White House report. It is apparently public, but it does take us some time to find this report, which we did, and the last one that we did see was dated October 4th. And as you can see with our red zone, the city of Dubuque as well as the county of Dubuque are still listed in that red zone. And then the next slide, Samantha. With all of that, we did also find in that White House report that in the state of Iowa, the following 3 counties had the highest number of new cases over the last 3 weeks. Number 1 being Polk County, number 2 being Woodbury County, and number 3 being Dubuque County. These 3 counties represent 25.4% of the new cases in Iowa. And you can see we are the green line right underneath the Woodbury County. And then Sam, if you can do the next one. And then Samantha did do this chart just this morning of an update for our positive cases per zip code. And if you remember correctly, we do have criteria that we have to follow from the Iowa Department of Public Health. So you will see 3 of our zip codes we were not able to list because they were 0 to 5 cases. So we were not able to put those on the dashboard, again, looking at the confidentiality. With the zip code.
Patrice, Supervisor McDonough, I have a question for you on this screen.
Sure.
why do you not have the numbers of increased cases? So I'd like to see every Monday when you share this with us.
Yep.
For instance, let's
Yeah,
just
and
take
you-
52001. Are you going to show us a
Right.
screen that shows the increase? So some kind of a graph that shows two colors in the 52001 area. It shows last
Yeah.
week's total, and then the next week's total. That's what folks are asking me about.
Yes. And actually, we did have that until about 5 minutes ago, and we did not, when we were looking at our change of the minus less than 5, we were not able to put that up. But we will be doing that with the changes. But again, they have to be, 5 cases or greater. And actually, we did have that prepared for this morning, but we did not have time to make that change. So.
And then also, as this data is put forth by the city of Dubuque in their graphs and grids, they always show the percentage of 100,000 people. I don't know how relevant that is to Cheryl Balltown of their percentage, or Farley compared to 100,000 people. It's not a number that means anything when you live in a city, under a couple hundred.
Sure. And what we do with that, and that is through Randy Gale, but it is with the incident management team, we just try to present data in different fashion because it is relevant to, some people, but not to everyone. So I know what you're saying, Ann.
Well, and so then again, let's stay right on this graph right here. What information on this graph do you think is relevant to the mayors, and what information on this graph have mayors asked you to prepare from? So what input on this graphs come from answer to mayor's questions?
Well, and as I said, Ann, we did have that comparison from last week on the slide that we just removed about 5 minutes ago. So this one, it probably just shows the increase in cases, but it does not have the comparison. And we will be able to do that this afternoon and share it. I sent it out to the clerks and the mayors, so they do get it. But we did not have time to make that change for the new slide.
And then have you asked the mayors what information they would like to have? Are you soliciting from them?
Yeah.
What information, what additional information they have, what questions they have that you could answer in some kind of graph form?
Yes, and we are starting to meet with the mayors. We were supposed to meet with one of them last week, and that mayor had to reschedule. So the incident management team is starting to meet with the mayors, and like I said, I have been sending out information to all of the city clerks and the mayors as well, as far as Halloween guidelines, influenza, our testing sites. We are communicating with them.
Okay, I'm sure I'll have more questions at the end of your presentation.
Okay. And then Samantha, would you like to do the next one then? And my Zoom thing is, oh, here it is. Okay, sorry. I was going to say my Zoom was not progressing up. And again, this one is based on the population size, and that was the one that you were just talking about, Anne. We're just trying to present the data in a little bit different fashion for everyone.
And this was another one that just needs to always have,
Correct.
As we talk about the spread, and it needs to be updated from week to week so we can see growth patterns. That's what is most concerning to people, is where are the active cases? Where is something happening we need to pay attention to?
Right, correct. Nope, and like I said, we had that ready to go, but we just pulled it about 5 minutes ago. So we will be doing that. Okay, and then the next slide, please, Samantha. Moving forward, looking at the White House report as well as our county Numbers, the incident management team continues to recommend the following actions. We are strongly encouraging the use of masks in public settings if they can't maintain that 6-foot distance for their social distancing. We do know that masks work. We do know that for some people, it's not possible to be able to wear a mask. So we do ask that they maintain that 6 foot for a distance to another person. But we can't encourage people enough. And when we say encourage, that's all we're able to do because, as you know, throughout the state of Iowa, there's no mandate. So we can only encourage, which we will continue to do. And then with the encouraging the city officials to utilize the new zip code data to develop better informed mitigation strategies for the community. The data has shown that this is a county-wide issue and all residents need to be social distancing, wearing a mask in public settings, washing hands frequently, and staying home when ill. And then stay informed about the new free COVID-19 testing opportunities that are available in Dubuque County and direct people to these locations as needed. Stay informed about the new free influenza vaccine opportunities available in Dubuque County and direct people to these locations throughout the fall and winter season. Prepare for the colder weather. As we transition to the fall and winter weather, we will not be able to be outside as much. People must continue to limit the size of their indoor gatherings, wear masks, and avoid non-essential outings. And then continue to fight pandemic fatigue and remain vigilant. It will most likely be spring or later before a vaccine is widely available to the general public. And then the next slide, Sam.
Patrice,
what we did,
if I might,
sure.
Again, Sam, if you can go back a slide, please. So moving forward, I guess my questions to you, and they may not be for today, but hopefully for next Monday when we meet again, you can explain as we move forward, and this seems to, it's becoming overwhelming. So what is it that the health board, the incident management team, what is it that we are doing that's different? It appears that all the things that have been happening are getting us to a situation that seems intractable. No change can happen. So what are we doing to look at things differently? We're encouraging and the city has mandated, and really to what effect? So what is it that we're doing differently? What are ideas to be different about how we interact with our cities, with our towns? What are we doing that's different as part of the way moving forward?
Okay, we will look at that for next week, Ann. But I know that we do, again, the masks, we encourage and encourage and encourage. We know that, some people choose to wear masks and some don't. But again, even with the Halloween activities coming up, we have presented to the city clerks and the mayors a variety of alternatives to Halloween, but the city officials are the ones, who will make those decisions. What we can do is provide.
Isn't what you've done is you've created a piece of paper, a flyer?
Correct.
So if what we're doing is giving out flyers and we're giving out, we're giving out flyers that people have to go to us and ask for. So to get to Halloween information, you need to know that you need to ask about Halloween information. So that would be an example of where I would say, what's our outreach look like? How many posters, how many contacts have Samantha had every week with the mayor saying, I want to come out and hang these things? I mean, what's our outreach look like? Not what's our production of flyers look like, but what are we actually doing to interact with people to say we have these resources available?
Okay. We will come back next Monday then with more information for you. Okay. And then Samantha, can you, okay. With the COVID-19 testing sites, we did list, and again, we inform people of these testing sites day in and day out. Randy does include them in our daily updates. Again, it's Epic Health, the Grand River, Hardig's, Union, Hy-Vee, and Locust. And then Hardig's will be doing their pop-up testing on Saturday, October 17th, from 10 to 2, and you do have to register online. So then the next one. We are also starting to gather information for the influenza vaccine clinics. We do know that in the state of Iowa, influenza continues to be at a low level, but we know that that's going to be changing. We cannot encourage people more to get their vaccine for their influenza because so many symptoms are very comparable with the influenza as the COVID. And if a person were to present with both of those, it would just not be a good thing for that individual, even though we know that the young age with the COVID and even some of the older population are asymptomatic with COVID. We just, if we have a vaccine that can prevent or lessen the effect with the influenza, we just strongly encourage people to get that influenza vaccine. And then also with our COVID vaccine, we continue to enlist our healthcare providers with our Dubuque County work plan so that when the vaccine does become available, we will be able to do a distribution through our healthcare providers. And we are also looking at the cost for setting up, if we were to need to set up a county-wide walk-in COVID vaccine clinic for a point of distribution site that we will be presenting to the Board of Health because we know that the budget planning is coming soon for Dubuque County, and we are just starting to look at if we had to do a walk-in clinic for the county, what that cost would be. So we are prepared for that.
Patrice, with regard to the influenza vaccine clinics, the Dubuque County has, I think, taken great initiative, and there's going to be 2 employee-wide vaccine clinics in Dubuque County for our employees, which I applaud our HR folks for doing that. So 2 days of testing, of free influenza vaccine testing for our own employees. Is there anyone working to encourage other influenza vaccine clinics to occur in an employment setting or generally? I mean, I realize that Crescent Community Health Center, that's being funded by HACAP funds, the Community Action Program. I believe Crescent is simply they're housing the vaccines right now. But so what are we doing to say to employers and to the community at large, you know, who's recording that information about influenza vaccine clinics? Certainly the county's taken a big step, and I'm imagining we're not alone on that.
With all of our meetings that we have, I'm just thinking with our pre-K through 12 as well as our higher ed, we have had that discussion, and many have already gone to their health occupation to set up their own influenza vaccine on site. I know that Stacy and her staff have been helping individual places, if they cannot go on site to do the influenza, to help them find a place that can go there. I know many churches are offering influenza vaccines after their services or their masses. It might only be a 1 or a 2 time opportunity, but again, those are being offered through that. As far as recording all of these, I don't believe, I know the incident management team is not recording. We do answer a lot of the questions on influenza, and we always work through any of the situations to lead them to someone who can assist them with those influenza vaccines. We do know that a lot of the pharmacies will have either a drive-up or a walk-in. Those usually require an insurance card, or if they do not have an insurance card, then they are charged a certain dollar amount. And I don't know if it's the same dollar amount across the board or if it's each pharmacy establishes that.
Diane, Pape Freiburger is posting in chat that influenza vaccines are recorded in IRIS, which is you know, where immunizations themselves are recorded. I would be interested to know in the influenza, perhaps our immunization subcommittee of the Board of Health could look at that as well, saying how many influenza shots were done last year and where do we look at to, you know, to get the population vaccinated this year. That would be good information to see.
And unfortunately, not all places enter that information into the IRIS. That will be something different with our COVID vaccine, because in order to be able to administer the COVID vaccine, that place also has to enter that information into IRIS. We wish that it was mandated for the influenza as well, but at least, you know, those who are recording, then Diane, Pape Freiburger, and the subcommittee could possibly look in to see what the numbers were.
Right, and I think it's important to acknowledge that the work that our subcommittee of the Board of Health has done on immunizations has started to create statewide ramifications for folks being required to report childhood immunizations to IRIS. There's great work that that committee has done and leading the state. So I think we probably know more about ISIS than anybody does, and I would include the Iowa Department of Public Health in that.
And I agree. And then the last slide is just, again, some local information or a website for the testing options.
Can I ask you another question about the COVID testing that's going to happen in Dyersville on October 17th? If I'm a person living in the Dyersville area, why would I sign up to be tested? I don't have any symptoms. You know, we're talking about a test that's going to happen in what, 5 days. I mean, it's not even on maybe my radar of what's going to happen. It just seems kind of, I don't understand why you would sign up for a test when you feel fine and the test is in 5 days. I mean, are we just asking people to do it broadly, widely, just to see what the result is? Kind of like a, hey, let's see what's out there kind of thing?
And that could be part of it. Another part could be a transportation barrier to come into the city of Dubuque for the testing. Another could be that people are now more concerned about being around a vulnerable population, whether it would be their elderly parent or grandparent or next door neighbor that they help out with. So it might just be a matter of many factors that now that the opportunity is presented in a closer setting to them and it's free, why, you know, that might be one of the reasons why they're going in to be tested. Or they may have had, you know, some type of a symptom over the weekend that they just really didn't know. Was it sinuses? Could it be COVID? You know, it could be many, many factors.
But if someone in Dyersville right now wonders if it's their sinuses or something, don't we want them tested tomorrow and not waiting until the 17th?
Well, we would hope, but again, if they had a transportation barrier to get into one of the sites into Dubuque, you know, at least this would be an opportunity for them. And also because so many people, the younger population, are asymptomatic, they might just want to go in to be tested because they know that their age group, that 19 to 40-year-old, is presenting most of the positive cases as well.
So do we want to get as many people tested as possible to find that out? I guess it continues right back to my same question, which is, why are we encouraging people to get tested on a one-day only event? There hasn't, is it because we're responding to a spike that's occurred in that area? Is it just that this is the time it's available and it's a one and only opportunity? It's, you know, I'm just simply wondering why I would recommend someone go do this, because why?
Supervisor McDonough, this is Ed Raber. The impetus for the Hardig drug, looking at this as an opportunity to do this, is because we have some regular connection with those testing locations, including Hardig's. And in one of those a couple of weeks ago, they indicated that they were interested in doing a pop-up like this. Some of the rules that govern the program that they are working with had apparently had some change, and that this was something that they now felt like they could do, and they are trying it out. So there had been some discussion about when they would do that. I, along with Patrice and the Board of Health, I worked with Charlie to identify some local partners there that would help them figure out how to accomplish that and spread the word in the greater Dyersville area. And they chose October 17th as the day that they were going to try that. They have a registration online, relatively easy to find for people that are taking the do I need a COVID test.com assessment. And Mr. Hardig indicated that they were just going to see how this goes, and that would guide them to their next steps or future actions.
So as many people as possible should be tested to show that there's interest in having testing in that area?
Yes, it would appear that testing right now in Dubuque County is at its highest level, and we're not able to conveniently track how many people from different, I don't have access to how many people from different zip codes are being tested. So we don't really know what that penetration is in that particular community or the communities surrounding it. It also isn't just for Dubuque County area residents. This community of Dyersville straddles two counties, so this may be a variety of people from a variety of areas. So
Patrice, another question for you. In regard to the 19 to 24 information data that you put out, total cases in the age population 19 to 24, some individuals have asked, I've heard this conversation. So when a person who is between 19 and 24, we think of them being college students primarily, but if your son or daughter attends Iowa State, but you live in the Asbury zip code, where would their positive test be recorded? At Iowa State, which is where they attend, and that's where, in fact, where they live at this time, or would it be back to their residence of their home in the Asbury zip code?
It would all depend on what address they are putting down when they're getting tested. For our higher ed population in Dubuque County, they are utilizing their college address, so those are being counted for Dubuque County. Now with Iowa State or the University of Iowa, it would all depend on what address they were placing for that testing.
So that's one of those things that's ambiguous. We don't know. If the
Correct.
52001 Dubuque Sageville, that does include most of our higher education institutions in the city, and to get free testing, and you're going to write down your Dubuque address in Iowa so that you get the free test in Iowa. But those kids could be going home in theory to Arlington Heights every weekend, and we wouldn't know that.
That's correct.
Inside the new software that you have, the DOMO, the DOMO that you refer to, are there going to be other ways for us to get answers to additional questions? Someone asked me, what's the current population, what's the activity right now from 0 to 17? They'd like to know pre-K, elementary, and high school kids right now showing how, and I know that there's things on the on the dashboards of the school districts, but how would they know how much of that there is in their own community by zip code? How much can you kind of analyze the data?
Yeah, and as we had mentioned earlier, that we were just in service 2 weeks ago on this, and the week after our main primary goal was to get our workbook submitted for the vaccine distribution into the state of Iowa for COVID. So in all honesty, we've not had a whole lot of time to go into detail with the DOMO, but we will be. I mean, we will be looking at all of the opportunities that we would be able to pull from that data to be able to share with the public. And we will move forward.
Okay, and then, but I'm also wondering if you could look at if there's a timing or a staffing issue, if we maybe had, you know, someone who's doing it on a contract basis. Obviously, you would train them under the HIPAA rules and such of Iowa Department of Public Health. But if we couldn't bring some assists with some kind of contract basis to bring more people to you to help further the release of information, if that would be something you would consider.
And right now, the state of Iowa is very, very strict on who they allow into this DOMO, because that's where all of our disease investigation is going on. So probably more than likely what we will do is again have Samantha be our point person of getting in to get that information and then be presenting it to the incident management team, because Samantha does have access into that.
And inside the information, are you able to see trends of where people are getting infected? Can you tell folks like, you know, we need to turn our attention much more specifically, kind of laser focused on this area or this city or these wedding reception venues? Do we have that kind of ability to focus in like that inside the new data?
Yeah. Actually, Stacy and her staff, primarily Stacy, would have more of those specifics, because again, even though IDPH does do our contacting with our positive and our contact tracers, Stacy does follow up with all of our positives and our contact tracing as well. And then Stacy does have, you know, that conversation, that face-to-face, or not face-to-face, phone-to-phone conversation with those people. And they may say, you know, oh, I was at a large gathering over the weekend. I think my contact tracers would be this person, that person, and this person. And then Stacy does follow up then with those contact tracers as well. So Stacy, probably by having those individual conversations, would have more in-depth information. So,
well, perhaps you could talk about it with the incident management team. That's another request that I would have, that I think also responds to what people generally are interested in, which is when all this contact tracing is being done, what is being said? Is the word football game or something, wedding reception? What are we seeing in the active cases at this time within the last 2 weeks? That would be helpful for us to know if we have to have targeted responses. And then the second question is, what are you doing? What is the Board of Health, what is the health department doing to be responsive to those things popping up?
And I know that it has been a variety of gatherings, anywhere from weddings to funerals to, again, those ATV, car shows, tractor pulls. You know, we have a lot of gatherings, and again, we can only encourage the social mitigation strategies. You know, again, we don't have a mandate to tell people to wear those masks or to stay those 6 feet away. So again, you know, we can only encourage people with those. But yes, I understand what you're saying, Ann.
So will we see more information with regard to that, or what's the way forward?
Yeah. I'll take it back to the incident management team, and we'll see what way we can present it. Yep.
And do you think we're at a time when will we be at a place where we're able to say we have worked sufficiently with city councils and mayors, and I need to seek some kind of data as to what your contacts with them have been. Are they sufficiently on board? Are they sufficiently informed that we can have a conversation about a countywide mandate? We've not heard a recommendation from incident management team. I've not had data back or conversation back about what's been done with regard to engaging our Board of Health, our health department, engaging the city mayors. We need to do that aggressively to see if there's opportunity there for there to be a mandate. When we voted against that, at least when my vote was cast, that wasn't to say that that was forever. It was opportunity to begin partnerships with those mayors and the communities. And I guess I can't assess whether or not partnerships is anything that we're actually making strides for and progress toward.
Mm-hmm. Oh, and I can share too, Anne, the incident management team was and still is very supportive of the Board of Health decision to present the resolution to the Board of Supervisors. So I know that we would still be very supportive of that Board of Health resolution.
I hear you, but I'm wondering if you're hearing me, that we need to
Sure.
create partnerships. And so when you feel you've got partnerships, then that conversation can come back and we can actually look at that again. I'm speaking as me as one supervisor.
Mm-hmm. Sure. Okay, and that's all that I have for this morning, unless there's more questions.
Thank you, Patrice, for your endless work. I know you haven't had a day off since March, probably before that, because it was budget time.
Actually, we got our first call from IPPH in February, so it's been a while. So, but thank you.
Thank you, Patrice. Any other questions for Patrice? Okay, we will, and Patrice, you indicated that Stacy was not available today?
Correct. No,
okay.
She had another commitment.
All right, we'll move forward. We'll go to our Sunnycrest administrator update, and I believe we may have Chris Kirsch.
Get in here.
Oh. Hi, Chris.
Hi.
Look at you modeling good.
Yeah.
Together, yay.
We're a little close, but we have all our PPE on. So everybody, let me introduce to you Tammy Freiburger. She has been appointed the interim as I prepare to leave. This will be my last week at Sunnycrest Manor. So today we did resident testing, and we also had a staff clinic this morning, 6 a.m. to 9 a.m. All residents have tested negative again. And our last, yay, thank you, Dave. Our last COVID positive resident leaves the COVID unit today. So he is 10 days out, symptom free, and he goes out today. We have 2 in isolation level 1. I know in my last communication with you supervisors, I apologize. I said isolation 2, that should have been isolation 1. We do have 2, their last day will be October 16th. So they're in isolation for a 14-day observation period.
And that's because they had a medical appointment or something outside the facility.
Correct? They had contact with a person who was positive.
Oh, very good. So it could be inside our facility.
Yes. So they're in isolation level 1 until Friday. And then 60 employees tested this morning from 6 a.m. to 9 a.m. All were negative. We continue that testing this afternoon, 1 to 3, and then again tomorrow morning, 6 a.m. to 9 a.m. So, anything else?
don't think so.
I don't think so. We're all set to participate in the COVID vaccination. We've completed all the necessary forms for that. Our pharmacy that we partner with is part of a national chain. So if the federal government does decide to go with the national chain, our pharmacy will give Sunnycrest the vaccination. However, if they don't go that route, Sunnycrest Manor is set up to distribute the vaccination, the COVID vaccinations.
Good. What have you done about the influenza vaccine for staff and for residents?
So our clinics start this Thursday for staff. And then we'll be we're in the process of getting responsible party permission for the residents. And then we'll be giving all the residents their flu vaccines.
And the pharmacy is delivering. I had received communication from Melissa at Mercy One, and the resident immunizations will be coming in this week.
And they'll be put into IRIS, right? Into statewide reporting?
Yes, we're a member of IRIS. Yes.
Chris, Dave Baker here, and I don't know if you were on. We had a Sunnycrest Manor nurse, not sure what her status is, and I don't think she was sure of that, but raised some issues under public comments. So I'm just asking you, not necessarily in response to that, but so that the family members of residents can have information, and I guess the general public, about the guidelines that we're following for PPE, such as gowns and masks. There was discussion or a suggestion about getting employees, the staff fitted for N95 masks. And then there was some discussion on gowns. I just thought we'd hear it from our expert on what we're doing currently and how that compares with the guidelines that are out there.
If I might, just before you begin, Chris, also, I think it's important for friends and for the public to know that the concerns that were raised in that public discussion were raised last week, and that we were in contact with you. Certainly I was, with the follow through of those things. So it isn't that that was a big bombshell dropped on us today. Those concerns have been raised over a period of time. And so now I would ask you to, as you've worked process through those things, let us know kind of what you're thinking.
Okay. So,
and Chris, if you don't mind, I agree with Supervisor McDonough. I also was contacted through Dawn Sherman. I know you had discussions on the issues that were raised, and I wanted the public to hear what's going on up there. That we're not able to do that, when somebody calls us directly and we try to work things internally. This is our chance to do this in a public setting. So,
okay.
Yeah.
Well, I am going to defer to Tammy, as she is our expert. She is our certified infection control preventionist, and she will give you just some highlights, not taking up too much of your time, but she will give you some highlights to assure you that we are following the guidelines as described in the CMS.
Yeah, we do have the current guidelines, as Chris said, according to the CMS, and then according to Department of Inspections and Appeals. We do have, it's kind of a layout where we have standards that we need to follow, and it's by which our state surveyors have come in and they evaluate us on, and have also recently come in for an infection control focused survey recently. And we did have no deficiencies at that time. They were just here within the last 2 weeks. So they have evaluated our processes. With regard to our isolation areas, we do have our COVID specific area down in our lower level. And according to regulations, we can use areas that are not typically used for a living area. So we do have our main dining room area that we are using, and we have made into a makeshift area that is entirely enclosed for our COVID positive residents. We do wear N95 masks in that area. We wear our face shields. We follow all the precautions with our gowns the whole time. We work only in that unit. So that is for our COVID positives. We did previously have our level 1s, which are our monitoring periods post-hospitalization, and also our level 2s, which are a symptomatic or awaiting positive confirmation, meaning sometimes test machines have shown that they could potentially provide an inaccurate result, that we would need to send an additional swab out for a more sensitive testing via PCR. So those residents where we need to verify are in the level 2. Also in that level 1 for post-hospitalization monitoring, we have the residents that may have come in contact with somebody who is COVID positive, and you're monitoring them. They have tested negative thus far, but we need to monitor them because we know that symptoms can arise anywhere from 2 to 14 days following exposure. So we're going to be monitoring vitals and everything like that. Now that area had previously been down on our lower level, but obviously I think, to make best use of our staff utilization, and also within our standards say that we have to provide a designated area. It does not tell you where you have to provide that designated area. And although it was nice to be down on the first floor, we were also finding that with our outbreak status, we had to look at a wider capacity and more beds and availability. So, and better utilization of our staff. So kind of collaborating with all that, we did block off an area in one of our villages. We moved out residents from that particular village and made that an isolation 1 and 2 area. Now it's blocked off, we have signage. We do need to wear the appropriate PPE. So we do don and doff, don, put it on, doff, take it off. And so you are able to do that and still maintain the proper precautions and the infection control standards. So going into that area, you put on your appropriate PPE, which is different than in the other area where you're taking care of the other residents in the area. So you're using your proper hand hygiene, you're applying your proper masks. So with regard to everybody wearing an N95 mask in the facility, that is actually not according to guidelines. The guidelines will tell you for a resident with known or suspected COVID, staff wear gloves, isolation gown, eye protection, an N95 or higher level respirator if available. It says a face mask is an acceptable alternative if a respirator is not available. We do have N95s available, but they are in limited supply. I do know that our unit clerk had been in communication and we had received additional supply, and so we have enough to use in our COVID area, which we absolutely do. We have enough to use in our isolation level 1 and 2. We also have KN95 masks that we can use, which are kind of a level above the surgical mask. And currently I am double surgical masks right now under my shield. So we do have the appropriate PPE to use according to guidelines. For every staff to be fit tested, we've had several staff fit tested, and it is $80 a person to go and be tested for a fit test when not all of the staff would necessarily be needing to work in those particular isolation areas. We've designated certain staff who would be working in those areas. So number one, there is a supply demand with N95 masks across the way. So for the whole facility to wear that throughout, it wouldn't be cost effective, not only for the testing, but also for the use. So we definitely are following all the proper standards according to CMS and Department of Inspections and Appeals as how we should be. I hope that makes sense. Does that make Any questions about that? It's kind of, I'm a busy talker. Oh, I can't hear you.
Thank you, Tammy. I had myself muted here. I guess on the fitted masks, are there times when someone who has not been fitted is out of necessity asked to go into the isolation unit, the positive unit, without a fitted mask? In other words, does that ever happen, or could it happen?
It possibly could happen if it was between the time of, and you know, I did go for the fit testing, and a lot of it, every time that I put my mask on, I have to refit myself to ensure that it's fitted appropriately. So that would be, you know, during a time frame when maybe the testing came late at night or something, where a person was positive and we needed to give a mask, you know, to a, you know, to another nurse.
But we wouldn't put somebody into the COVID unit without
no, not
being tested.
No, not into the COVID unit.
No.
Never. Not a single one of our COVID, so not the COVID isolation. And there is a difference as long as it's understood that we have two different isolation areas. So the COVID unit, you must be fit tested. You must wear an N95 mask. So under no circumstances ever would a person working with the COVID positive residents, known, verified, confirmed, be asked to work in an area where they have not been fit tested with an N95 mask. Now, the other area, the isolation 1 and the isolation 2, where it is not verified or you are monitoring, you are not required to wear the N95 mask. So that area is a totally separate isolation, and kind of what I just read in terms of the guidelines for you from CMS and from Department of Inspections and Appeals that guides us, specific guidance, and for how they come in and evaluate us, indicates for a resident with known or even known or suspected. We don't, for our knowns, absolutely do not. We follow practices of wearing the N95 mask. So for known or suspected, staff wear gloves, isolation gown, eye protection, and an N95 or higher level respirator if available. A face mask is an acceptable alternative if a respirator is not available.
Okay, thank you, Tammy.
You're welcome.
And Chris, of course. Okay. Any additional questions for Chris and or Tammy?
No, thank you both.
Thank you.
Thank you.
Thank you. Keep up the great work.
We will.
Thank you.
Okay. Next up will be our emergency management team update. We'll go to our manager of our director of our emergency management services, Mr. Tom Berger.
Morning, Dave and supervisors. I don't have much to add other than you know, what Patrice already presented on behalf of the incident management team. I do know that I've worked with Chris and Jackie and everybody at Sunnycrest as far as getting them the appropriate PPE and that they're using, following the guidance, you know, then we're able to obtain from the state as far as the N95s. So, and that goes for all the other healthcare facilities as well. So if they run short, they know how to obtain them supplies. So other than that, I really don't have much. We do have an accurate account. We do have the 28,000 procedure masks here yet that you have purchased. So that can be used for community events and functions. And I was contacted by a couple last week after the meeting, you know, requesting them to hand out to the public at their event if they wouldn't have any. So the word is out and I am getting calls on it. So that's pretty much what I have, unless you have any questions.
Thank you, Tom. That's great.
Thanks, Tom. I have no additional questions. Thank you. Okay, we'll move on. Ed Raber on the testing update.
Thanks, Chair Baker. This is Ed Raber. I only wanted to highlight just a couple of things. There's been a lot of discussion already about some testing, but according to the state's website, just to contextualize some things for you, in the last week, there have been about 3,300 tests that hit the dashboard for Dubuque County. So as we've talked several times, that's not the total number of tests, but those are the number of new individuals and individuals that have previously tested negative, but this time tested positive. They show up on the dashboard again. So 3,300 and just about 433 positive tests were attributed in the days Saturday through Sunday this last week. That's about 13% positivity rate for those that made the dashboard. Just to make sure that this was noted here in terms of the free testing locations, it seems that around the state of Iowa in the eTrue North pharmacy program that Hardig's and Union Pharmacy have been participating in here in Dubuque County, across the state of Iowa, a lot of those locations are actually Hy-Vee locations rather than a local pharmacy. And the Hy-Vee on Locust Street has recently started to use that program, so that's a location. And as I looked through the doineedacovidtest.com site for Iowa locations, it looks like Union Pharmacy was not listed there this week. So I don't know, I have not been able to reach out to them, but it looks like they're not on that list, but the Hy-Vee on Locust Street in Dubuque is. So testing has never been at a higher level. We continue to get more people that have not previously been tested to be taking a test. We had 2 days this last week with over 700 people on the dashboard. So that's pretty significant, as well as the total number of people that have tested positive. So within that, I've asked just this morning here, based on what Patrice had asked, had noted about that they've been reaching out to cities as well. I've always tried to make sure that I was keeping them abreast of the communications and activities that I was conducting or conversations that I'm having, and I asked if they might consider keeping me in the loop to kind of help close some of those things so that I would be knowledgeable about what sort of things that they're doing and how those conversations are going. And I will use that information to make sure that we are informed.
And a question for you. What is the positivity rate that we are aiming for? What is our goal?
I would, not to be cheeky, but I would say probably 0, of course. The state has...
I'm not attempting to quiz you. I mean, I understand.
No, I know, I understand. I understand.
5% would be, you know, hey, that's a whole lot better than where we're at. But when will we see positivity rates for each town?
And again, as I said, I've reached out even this morning back. I've enjoyed the back and forth that I've been able to have even last week with the health department staff about how they're reporting those things. I think they continue to look at ways that they can do that. I am not one of the individuals that can get in and look at that data, but I've appreciated that that the assistant director has been responsive to looking at a couple different ways to display that information. So I wrote down the conversation notes from this morning, and I will be back in touch with them to see if we can continue to improve on the usefulness of the information that we are presenting and doing it in a way that is responsive back out to those stakeholders that are looking to this for information.
Right. We had a meeting about 2 months ago, the mayor's meeting, the now infamous mayor's meeting. And that was information they were asking. What positivity rate is the target? What positivity rate are we at? And what are we doing to change that? And when we're going to try to create partnerships with these, the smaller municipalities, we're 2 months later and what have we got? So they still don't have answers to those questions. And we need to, if we can't get it or we're not going to be able to get it, which is what they suspect, then we just need to say, well, I guess the data we're going to focus on is these points. They would like us, as you know, from speaking in depthly with at least one mayor, they have some pretty specific things that they would like us to be directing them to feel they're better informed. It was on the front page of the Commercial Dyersville this week that their city council took this up. Lots of good conversation at their city council meeting about this, looking for, they have questions and they don't have answers and they really need more questions and we can help them formulate those too. So it's a work in progress.
Right. It is understanding the data that's available to you is one thing, but I think also understanding that helping how we're using that to help shape behavior and thoughts among our population here in the community and those that visit our community is the important part. I do not have a percentage that I can say what we're aiming for, except to say, I think we're all aiming for 0 at some point.
Right. So would you agree with me? We need to work and develop those relationships better?
Yes. I have appreciated the willingness of those community leaders around the county to be a part of that discussion and to share their thoughts and to also reach back out to us. So it is an actual dialogue. Yes.
Right. To be continued.
Yeah, Ed, Dave Baker, I'm going to jump back to the upcoming testing site, pop-up site in Dyersville. And, you know, there were questions about why we doing a testing site. I recall that Epic had set up sites in Epworth, for example, and there was probably, I don't know, hundreds of people turned away. I think we're always trying to reach out and, you know, include our smaller towns and the rural areas when we can, not make them drive to Dubuque. But in Dyersville, don't we, I mean, wouldn't this be something that high school sports, athletes and their parents, band members, and other extracurricular activities, they would be able to, instead of traipsing off to one of the sites in Dubuque, utilize that, and they may be required to test on a somewhat regular basis. Asking if that's went into this process, or if that might be a perhaps an unintended benefit for the folks in the Dyersville, Cascade, and then Farley and Epworth areas, and others.
Sure. I have been able to have some, through this process, have some conversations with some of the other partners in that community. Obviously, people in other parts of Dubuque County and Iowa are being tested with some regularity. As you point out, school students, faculty, whether they're participating in a particular extracurricular activity that requires it or necessitates it, they are doing that. When I talked with some of the education leaders, they indicated to me that people are coming into the Test Iowa clinics in Dubuque. They also surprisingly and are happy with the turnaround time for that. But in fact, they indicated that there are some that actually have driven down to Iowa City, to the University of Iowa, to be tested there. So that's a fairly significant commitment to go do that. I believe that the aim for doing that was that they thought that they would get the test results quicker, and they were looking for a PCR result. So people are doing things in order to satisfy their perceived or required need to be tested. So continuing to have those discussions with those community leaders that have a local pulse on what's going on within their institution or in their community has been helpful. So there are people doing all sorts of things in order to go be tested and to get a result back as soon as they can. Sometimes that's because there's an event or some other thing that's coming up very soon, and they need to have that result back by that time. Patrice did not do this during her time, but at her board meeting on Wednesday last week, as part of the Dyersville program. And so I apologize, I do not have anything prepared. I guess Patrice did not bring that up, but before this gets away from us, I wanted to note that the Board of Health had a request from Hardig Drug in the preparation for that through the EMS and the Public Health Department, where we're merely a partner in that. Hardig Drug had asked for assistance in providing PPE as well as some signage for that event. And I don't believe that Tom Berger mentioned that, but in a routine way, that is what the EMA does. And apparently they've worked out what PPE they need for that event. And I think Tom Berger has that on its way or ready to be on its way. The other request that they made to the Board of Health was for a quantity of signs. They want this to be a professional looking event that helps the people who will all be scheduled individuals knowing when they arrive on site where to go, where to stop, when to advance. So for some events held in Dubuque earlier this summer, Selco Signs had prepared a series of signs for some events that we did, and they prepared them, their signs, and based on wanting a quantity of those signs for that site, which is going to be at Beckman High School's parking lot, they asked the Board of Health for to help them with those rental fees for those signs. And so Selco had provided the Board of Health with a cost estimate for transporting signs to Dyersville and then picking them up and bringing them back the following Monday of $700. So that's, I don't believe particularly about the cost of, they had asked for 16 signs. I don't think the cost would be different if it was 15 signs or 17 signs, but they're asking, that is the participation that Hardig Drug made to the Board of Health. Board of Health, Patrice didn't report that, but the Board of Health unanimously, I believe, supported that enthusiastically, but apparently based on the way the budget amendment is, that comes back to you. So the Board of Health has recommended $700 for Selco, which owns the signs about testing, that has the directional arrows about testing and things that were developed for a previous event. They're asking for those resources for the event on Saturday.
Okay, thanks, Ed. I wanted to also mention that, yes, and I think for that, I think Tom Beschen, I'm guessing, will be addressing that. So, and he's up next after your report.
Is he actually? I didn't know that he was actually going to be able to be here.
Oh, maybe he's not. Okay. I see Diane Pape Freiburger, who's the vice chair. So why don't we?
Hopefully, I have merely. I knew that Mr. Beschen was not going to be able to join us today. So if if someone else from the Board of Health is here, that's great. Hopefully I have communicated the information that they had planned to as well.
From the
There was
point area where I grew up, we call that greasing the skids.
Well, we'll see how that goes. Hopefully that's what I did.
All right.
What I'd like to ask and note that it's not at all in our packet today.
Correct.
Okay, well, again, I think we defer to Tom Beschen or Diane Pape Freiburger, and then we can still discuss it because we have that overall topic. But you're correct, Dan, we may not be able to take action on it today, but we can certainly discuss it and possibly give our thoughts on it. So, okay, Ed, I had one other thing, and I want to thank Diane Pape Freiburger, Ed Raber, and Tom Townsend, and all the volunteers from the Dubuque Area Labor Harvest. We did do a mask distribution this past Saturday, and that was an idea that Diane had come up with, and made that happen in just a few days. It was relatively small scale, but I think it shows the level of cooperation, and I think we know we have different networks out there that we can get masks out to folks. So I think that was a good step. It might have been a baby step, but good step in the right direction. But thank you, and Diane and Tom Townsend from Dubuque Area Labor Harvest for, and I can go on and on because of all the volunteers that the Labor Harvest has. So
I'd add to that, Chair Baker, that yeah, I didn't do very much. Diane dropped them off to me, and I took them to Tom Townsend. But so very minor, except I got to chat with Tom Townsend, which was helpful.
That's always
that the individuals that the Labor Harvest delivers them to tend to be people in need of food that are very vulnerable populations, and it's cloth mask, and there were over 100 of them that another volunteer, local community member had produced those, and that's where the kudos go. There are still people making those masks and donating them, and so getting them into the hands of vulnerable people is important.
And we have distributed over 1,000 of the disposable face masks to date, and there'll be probably another 2,000 going out this week.
I can say that the masks were well received, and some people were surprised and happy to get them. So, okay, anything else, Ed, on your report?
I'd note that I have had an opportunity to talk with the Grand River Medical Center people. We have kind of a standing call, hopefully, as we move through this, and just to make sure that they're not hitting any barriers or any other things, especially as they kind of get new to the program here. So they're doing 100+ tests a day, and that's about what they feel like their capacity is, and it's going well, and seems to be a good spot for it. So they're very pleased to be a part of that program, and we'll continue to make sure that I'm touching base with them to see if they run into any hurdles or things that they need some assistance with.
And I'm going to use a little discretion from the chair here, and I think we did this last meeting. You also have the update from Dubuque County municipalities, and I know that we've received some positive vibes, I guess, from some of our small towns, and I'm going to use Dyersville as an example. I think now the city council and mayor in Dyersville are talking about voluntary use of masks and that type of thing at their meetings, and there's others. If you want to give a elevator version of that, I know Supervisor McDonough and myself have been encouraged and have been wanting to involve the mayors and city councils and city clerks in this. If you could give us just a brief update on that.
Sure. I'd say, as I think was noted, Dyersville Commercial ran a front page story about the Dyersville City Council. Again, in general, I would characterize the communities around the county. Almost half of them have responded back to some communication that I had sent on the county's behalf, asking for how they're following up on this mask covering, face covering issue that was a few weeks ago before the supervisors. As they look at ways in which they're trying to influence behavior of their residents and people visiting their businesses, a couple of them have adopted their own formal mask recommendation. None of them have attempted to do anything like their own local mandate. And even those that have not made a formal mask recommendation using the template that we had provided to them, most report having thoughtful discussions at their city council meeting. The city clerk from Rickardsville over the weekend emailed me a quick snippet saying that they had discussed it, not interested in a mandate, but they have taken these opportunities that have been presented to them to reach out to their business community or residents to ask them to look at ways that they can encourage that. Most of them, the feedback that they've received is that they're not looking for a mandate, but that they're continuing to try to recommend it and use it in their own institution. So
but there's been another crack in the firewall, so to speak, there, because I've had 2 cities reach out to me, individuals from those cities, indicating that they wish to have the county do a countywide mask mandate, that they maybe are not satisfied with the direction of the city council, and that there's not going to be change that's going to happen, not even a recommendation. So, or the belief that it's being thrown back, that they don't have the ability to do this themselves, and so it's going to have to come back to the Board of Health, maybe for a resolution that's created with their input. And maybe we go at this in a maybe more thoughtful process, but that I think is a new change, that there's interest in saying it's not going to happen here. We don't believe we have the legal authority, but they're recognizing that maybe the Board of Health does have that. So there's things are in motion.
I'm just providing the context back of the communication that I have received. So there could be many layers of that communication. That's the stuff that I've gotten back from city council meetings. So, and I'll continue to work with the supervisors in the communication. You're a much more accessible feedback channel for a lot of individuals. I look forward to the opportunity to connecting with you this week and figuring out what all those layers of discussion are, and any next steps that we can help with, whether that's more discussion or some additional planning or a group meeting.
Chair Baker, you're mute.
Whoops. Thank you, Ann. Okay. Anything else? Any other questions for Ed? Ed Raber?
No, thank you.
Okay. We'll go to next item on the agenda, Board of Health update. And I don't see Tom Beschen, but I do see Diane Pape Freiburger. If Diane wants to give an update, I know that Chair Tom Beschen had sent out an emailed report. Diane, I don't know if you have anything that you want to add.
Chair Baker, this is Diane Pape Freiburger. I do not have anything additional to add other than what Chair Beschen had sent to you and the other Board of Supervisors on Friday. I can give an update of what we did at the Board of Health meeting the other night.
Okay, that'd be great.
Okay, the first thing we had was a COVID update from Patrice Lambert, and she explained the updated quarantine guidance that was issued by IDPH regarding close contact exposure if both individuals are wearing masks. And she also explained that the research does not support the use of gaiters or face shields as effective protection at this point. And she also explained the difference between the CDC guidelines and the IDPH guidelines and what the school districts have chosen to follow. At least that was what they were saying last Wednesday. With the budget, we'll continue to work for the budget for 21 and 22 fiscal year at the regularly meeting of the Board of Health on this December, whatever the date was. We don't have that. We're working with Stella Rundy to follow the process and the schedule for the budget for next year. Face mask reimbursement. Dubuque Community Schools had approached the Board of Health for reimbursement on masks, but they've also applied for FEMA reimbursement. And so we will give consideration to their request after they have found out from FEMA whether they are going to get any reimbursement from FEMA. And so that is actually on hold at this point. We will revisit it if need be in the future. There's CEC, which actually did the internet and the wireless for the remote site at Grand River Center. And the proposal was for $1,045 to move the wireless back inside after the COVID testing is done now. And this also would need to be approved by the Board of Supervisors from the communication that we received from CJ May 2 weeks ago.
Diane, I believe that's already been paid. I think I signed that claim last week.
Well, okay, we were not aware of that.
Now, that came in under the original billing. I mean, it came very late, but it was under the original billing of the Grandview, the Grand River Center 2 days of testing that the Board of Health, or excuse me, the Department of Health did way back in May. So that bill has been already authorized and the check's in the mail.
Thank you, and I will forward that information back to Chair Beshin. And I don't see whether Samantha or Patrice is on, but I'll make sure that they're aware of this also, and Bailey, who would be doing the invoices. There are many influenza vaccine opportunities, free and at cost, which would be applied to insurance in Dubuque County. And for the VNA free testing, you would need to make an appointment, or as stated by Patrice, Crescent will also be having a drive-through in Flora Park. Then as far as COVID-19 test site signage, the Board of Health approved a request for $700. It was actually the approval was for $700 for signs to be used at Beckman High School, as stated by Ed Raber. And this also would need to be approved by the Board of Supervisors. That testing is this Saturday. So with that, our next meeting will be Wednesday, October 21st, 2020 at 6 p.m. Are there any questions?
Thank you, Diane.
Thanks, Diane. I don't have any questions. And thank you for the report. I guess as long as we're on the $700 for Sokol, that does not give me any heartburn. And as Supervisor McDonough had suggested, I think some of these get approval through our normal process with two supervisors reviewing, but we can discuss this at today's meeting if there's any issues or questions on that. Again, as I said, I don't have a problem with this. Having an orderly pop-up testing site, orderly and safe, is important. And if using Selco and their services helps with that, I'm okay with that. So I don't know. Ann, if you have any comments on that?
I'd like to have seen it in the packet.
Okay, I understand. I wasn't asking for action. So, all right. We will, I guess, have to schedule that in some form. I guess I'm directing this to Dawn Sherman, that we need to get that on with a possible action item for the next meeting. So,
Chair Baker, this is Dawn. Since there is no contract that you'll be signing, your normal procedure is just through your claims process. So the health department would just process that claim, and two supervisors then sign off on them, because you're not signing any contract. It would just be paying that claim. So the board's approval is through that process.
okay, that's kind of what I was alluding to, and what Ann had pointed out with the previous bill that they referred back to us. But
well, the previous bill was the $16,725 reimbursement to the University of Dubuque, and that did come before us as an action item, as it should have, due to the fact that it was a large sum of money. It wasn't in the ordinary course of anybody's way of practice, certainly. But and I've had citizens ask me what happened to that. Did we do that? And I said, oh, yes, we did. But this one, the $700 is just about de minimis, which is routine types of things. But again, those are the only opportunity we give citizens to be aware of how we're spending their money is in the packet. And if it's not there, then it's all just, you know, you have to catch it or you have to know it's going by.
right. And as you said, the University of Dubuque item was in the packet, was discussed in public meeting and approved. And I think I was referring to the electrical relocation one that I thought you had mentioned, that we signed off on that.
Right. Because that was from an event that we had budgeted and discussed early back in the springtime.
Right.
Late invoice.
Yeah, and I guess my point is that this is similar to that. This is a, unless we disagree with them holding the pop-up location, we have already allocated funds for this. But I guess any supervisor can ask for a work session to discuss an item. So if we need that for this, we can do that. So
we also have staff whose job it is to get things on the agenda and to get things in our packet so that we have something before us, so that is transparent. So that would be my question. I don't expect anybody to answer it today, but the staff need to get to us what is needed.
okay, thank you. All right, anything else for the Board of Health for Diane Pape Freiburger, the Vice Chair? Any other questions?
No.
Okay, thank you. All right, I don't have any more questions. Thank you, Diane. Okay, that will end the COVID-19 portion of our meeting. We're pretty close to being on time. We have I guess, a couple of work sessions scheduled here. Ann, are you prepared to move forward, or would you like a recess?
I think we should give our staff a recess, motion to recess for 10 minutes.
All right, and I second that. All in favor of a 10-minute recess signify by saying aye.
Aye.
Aye, carried 2-0. 10-minute recess back at 11:44. Thank you. Okay, guess we'll reconvene the Board of Supervisors work sessions. Next up is a work session with Sheriff Kennedy to discuss and approve reclassification of an open position. And I think we'll go to Sheriff Kennedy and Don Sherman, our Human Resources Director.
Morning, everybody. Thanks for taking some time to listen to us today. Can you hear me all right?
I can hear you just fine, Sheriff Kennedy.
Okay, thank you. So recently we had a retirement for our custodian. We had, just for some background, we had one full-time custodian and we had 3 full-time maintenance personnel, and then we had Jay Gonzalez, our technical operations superintendent. That's what our maintenance division consisted of. When we were looking at doing the replacement for the custodian, you know, we talked to Jay about what his needs were moving forward, and he brought up the possibility that maybe we could transfer that custodian position into another maintenance position. And I know Dawn ran some numbers on it, and for what we have budgeted for the custodian position, it actually, if we were able to move to the maintenance, or move that position to a maintenance position, we still actually would save money under the budget. By the time the person was done working on the 15th of September, so that's a month's worth of wages we already have not paid for that position. And then it's going to take us, by the time we put out for applications, do interviews and background checks, I mean, we're talking another month and a half to 2 months out. So for what we have budgeted for that position, we're definitely going to be still under budget for wages and benefits. But I'm going to turn it over to Jay here so he can kind of give you some of his points and reasoning for wanting to make the switch.
Hello, everyone. Thanks for your time today. I'm Jay Gonzalez, the Technical Operations Superintendent. Just to get into things here, personally, with switching over to a maintenance position, we just get better qualified applicants, more skilled applicants for this said maintenance position. For what we do over here, a custodian can't do a maintenance position's job, but a maintenance position can definitely do a custodial job. And currently the maintenance people already do custodial work. Just some numbers here for you. Work orders here, written work orders, we get anywhere between 40 to 60 a month. And that's the written ones through our system, and then verbal between said maintenance people, and just anybody throughout the building could get another 2 to 3 work orders more a day. And then just the fact that we are a 24/7, 365 secured building with, you know, multiple departments in this building, or both buildings, I should say, that, you know, sometimes need to be fixed now and can't wait, especially like locks and security locks that are to the outside of the building. You know, that stuff just can't wait to be fixed. It needs to be fixed now. You know, 90% of our work, I feel like, is done in-house, and it's definitely good to have rotation for the guys, especially if I have to call one of them in to fix something. And then, as Sheriff Kennedy explained earlier, just, you know, we already are under budget, and it's not that big of an increase. So.
Well, and I think too, Jay, if you want to highlight, you know, I mean, how many plumbing fixtures we have here, how many lighting fixtures, how many electronic doors. I mean, these are things that are moving parts that are consistently breaking, especially when you consider the inmates who intentionally break off things like sprinkler heads and things like that cause maintenance problems. So if you want to just touch on that a little bit.
Yeah, so funny story, just today, even not even 5 minutes ago, had an inmate break off a door handle. So, I mean, that's just another thing that, you know, like Sheriff Kennedy said, we have people in the building that purposely like to break stuff. I mean, if you think about it, we have plumbing fixtures in every single cell I mean, and the door locks on every single cell, every single door through the building. Just the other day, we had two door locks go bad that took up some time, you know, between the maintenance staff. And yeah, I mean, really, it boils down to a lot of the plumbing that we have in the building for sure.
Okay, Sheriff Kennedy and Jay, I had a question. So you mentioned the budget, and it looks like for this year, it was a budgeted position as a full-time custodian and been retired for, it sounds like about a month, and there's going to be some savings in the FY21 budget. So that's, it looks like that's, the money is budgeted, so that's kind of a non-issue there. However, going forward, it looked like it was a little over $1 an hour, be a little over $2,000 difference, but that will be adjusted then. It would be an increase in next year's budget. Is that correct?
So yeah, it'll start showing an increase in the following years for FY, 22, 23 and stuff moving forward. But our concern is that, we feel that by getting another maintenance person here versus a custodian, we get a little bit more bang for our buck. We have somebody, like for instance, when we have our maintenance people, say one of the maintenance personnel are either calling sick or are gone on a vacation day, it's burdensome for the rest of the guys in that division to have to kind of pick up that person's workload. So we're just looking for another person that can kind of help out, pick up the workload, and just keep us up and running on a day-to-day basis.
Okay, thank you, Sheriff Kennedy. I also had, I know the answer to this. I just kind of wanted for transparency. So will this in any way result in outsourcing of any additional custodial hours or create a need for any additional part-time custodial employees?
No, not that we can tell.
Okay.
We feel that this position, people going into this position will need to understand that in addition to doing, electrical, plumbing, that type of work, that they also are required to do, they have cleaning areas that they're responsible for. So yeah, I mean, we just ultimately we want to continue to do as much work as possible in house, and that this position will help with that.
Okay, and I ask that because I know from previous experience that sometimes people are tagged with maintenance. That's their title. They kind of turn their nose down a little bit at custodial work, but that'll be emphasized in this hire, I'm assuming.
Absolutely. Yeah, absolutely.
Okay, thank you. Supervisor McDonough, any questions?
So Sheriff Kennedy, you no longer need anyone in a custodial capacity, is that correct?
Well, I mean, we still need people to do the cleaning. If that's, I guess I'm not exactly sure, what you're asking, but we still need people that can do that kind of work, cleaning, take out the trash, do like grounds maintenance, snow blowing, lawn mowing, things like that. But we just like to have somebody with a little bit, some added skill sets other than just, just to do cleaning and stuff.
I understand that, but then you're no longer going to have anyone with a job description of
Oh, okay.
Right?
Yeah, I see what you're saying now. Yes, we will no longer have custodian.
Okay. And then is there anything we need to do to change officially the maintenance job description?
The only thing that we discussed currently, apparently on review, that you're not required to have a valid driver's license to do the maintenance position, which our maintenance guys drive around a lot to pick up supplies and things like that. So that's one thing that we're going to change with it, but I don't think that that's going to prevent us from getting qualified applicants by adding that provision.
Okay, I just would ask that as we drop out the custodial job description, and it sounds like that's not a classification or a job description we want to use, does maintenance say everything that we want it to say? And that I'll leave that between you and Don Sherman our HR director, but I don't have a problem with your request to reclassify.
All right, thank you.
Question for Don Sherman then. It's kind of related to Supervisor McDonough's question. Do we have to do an amendment to the bargaining unit, or is the custodial position still going to exist, just not being filled at this time?
Correct. We would not need to do that because if for some reason the sheriff under this contract wanted to bring back the custodial position, it would still be covered under the union. So they would not need to amend their certification because we would still recognize that as a bargaining unit position.
Okay, thank you. And that's not uncommon. Is that correct, Dawn?
Correct. Yep. Because we would always want. We're not eliminating any bargaining unit positions. The maintenance position is also covered under this bargaining unit.
Thank you. Okay. Any further questions, Supervisor McDonough?
No, I'm looking for a resolution. There's not a resolution to.
It says work session with Sheriff Kennedy to discuss and approve reclassification of an open position, and the materials were provided in the packet.
That's correct.
So
But there's no resolution. So what would you like?
No,
Dawn? What do you need?
So there is no resolutions with personnel requisitions. This was the item that was tabled under your meeting 10A, Maintenance Sheriff Department. So it would be under personnel requisitions. You would make a motion to approve the requisition as submitted.
Motion to approve the personnel requisition.
Second. Any further discussion? All in favor signify by saying aye.
Aye.
Aye. Carried 2-0. Thank you, Sheriff Kennedy. Thank you, Dawn.
Yep, thank you much. Appreciate it.
And Jay as well. Thank you. Okay, next work session. We did a little catch up here. Work session with our General Assistance Director to review the reports. This was tabled from the regular meeting of the Board of Supervisors, and this would have been under item 3B, and we did table that. So I guess I'll start by see if Don Sherman has any comments, or Stella Rundy, our budget director, to get things started.
Hi, Chair Baker. This is Dawn Sherman. Stella and I did work with Josh to develop some different reporting based on feedback that we had been hearing in previous meetings. And so those are what are included in the packet, and I'll bring up here and share on Zoom shortly. It gives a little bit more detail to the applications that are being approved and denied and withdrawn. And it kind of shows more of a financial statement look. So we've worked with them where, you know, if there's something different you'd like to see, we will continue to work with Josh and his staff. We just thought this was a good summary of, you have both year end of FY20, and then you have in your report the first quarter of FY21 included in your packet.
Dawn,
And Josh can walk through those a little bit more.
You're not screen sharing. There's nothing coming up.
We don't have anything on the screen at this point, Dawn. Oh, looks like we're heading in that direction.
Is Dawn still able to talk?
I'm here. Sorry, I had myself muted.
So this is the format that you and Stella have created for Resources Unite to use?
Yes. We thought this would, with great help from Stella, she designed it, and then they're able to put in all of the detail to it. So they're putting in the individual cases in there, and then obviously those all get totaled up from, this is originally an Excel spreadsheet for them to input their information.
And then for purposes of Excel spreadsheet, do we have their data from last year as well going in?
The report that I have up here on the screen is the FY 20 report, and so it does have the detail of the case number and what was approved for payment under in front of you rental assistance.
So when did Resources Unite take over the program?
What was that? I'm sorry, what was that question? It's hard to hear in the boardroom here.
When did Resources Unite take over the program?
I believe it was, I'd have to look at the day.
I believe it was September 1st.
Of 2019.
So do we have running numbers then from September of 2019?
Yep, Dawn, if you want to go to that first page, I can kind of walk through what some of this is. So this first page of the report would show the fourth quarter in column 1, so April 1st to June 30th. And then in the second column, it would show the year to date. So that would be September 1st of 19 until June 30th of 20. So we're trying to get to showing the data side by side so you can see one quarter at a time and then the year to date information.
And then are you bringing that forward? Like, for instance, that September, or do you have any comparisons year over year?
We don't have comparison year over year from the previous program director per se.
I understand that, but do we have year over year now with Resources Unite?
We would have part of a quarter for the first quarter. So they didn't take over until September 1st.
Correct.
So it would be 1 month of the first quarter.
Right. And all I'm asking is, as we're developing these forms for them to use, are we also asking about year over year?
We hadn't designed that in here, but we can certainly add that.
Because that, I think, is going to show us what it is that we're looking at as this moves forward, is the year over year comparison.
Yep, I can add in a prior year column. We can add that information in easily.
Right. And the other thing I think we should be able to do, and it probably is a tally, unfortunately, is to know how many appeals were heard previously. And then, you know, I continue to have that be a significant concern of mine. The extraordinarily low number of appeals can be determined to be a success, that the program's working beautifully, or a fail in that the program appeals, we don't know anything about that appeal process, and it doesn't appear that anybody's using the appeal process. So that's concerning. And, you know, it would be nice to know what the number of appeals were prior to Resources Unite taking this over. And then also, you know, if you want to stay on the topic of appeals, what specifically is the appeals, who's on the, what is the process, who's on the panel, who makes the decisions, how often do they meet? Because the lack of appeals that doesn't appear to be very reflective of what the experience I would have expected.
I can let Josh address some of those things. We just wanted to, what we would like to get to is submitting these applications, excuse me, these reports quarterly and getting to the information that the board would like to see on a quarterly basis, where it would be kind of received and filed for your review, and only work sessions as needed instead of
year over year.
Yep. Okay. So year over year, some more appeals data from our previous program.
Right. And we clearly have a burial problem.
So I can let Josh address the actual data in the reports.
Right.
I'd like for him to go over. One other thing that we need to address is closing out the fiscal year 20 and moving into the 21. So we haven't closed out fiscal year 20 yet,
Right.
and what the board would like to do there.
Well, could we have it be audited? What are your thoughts on that, Stella?
We could.
Well, are you
Yep.
considering your overview to be an audit type process?
I would not consider this reporting that we've done here to be an audit type process. We would need to do some testing if that's what we're doing.
And then, you know, I don't know in terms of, I don't know if we have any of these other relationship of this kind with any other vendor. So I don't know if we have procedures about when, for whom or when or what dollar amount we'd like to have there be some kind of audit done, or what our expectation is. I guess all of this is, you know, maybe new. I don't know what it's parallel to in our experience. Do you know? Do we have another sample of where we've done this with other vendors?
I don't have anything that I can think of at the moment.
Okay, so then it becomes best practice. And I'm not reflecting on Resources Unite at this point. I'm talking about, you know, again, what would the practice of the county be in terms of overall budget that we give to this vendor, to RU, to do the work? And then would we want to audit? I mean, you know, what's the total budget here?
So the total budget in FY20 ended up being just short of $180,000 because of the influx during COVID.
Of the additional numbers that we,
Yep.
additional budget numbers.
Yep.
So on the page that I guess Dawn has before us right now, it shows the year-to-date funding. The quarterly report would end the fiscal year 20, right?
Hold on.
Yep. So because you did an additional funding in that fourth quarter of the year,
correct,
you can see that additional funding was added, and then the total year-to-date funding was $179,838.49.
In the where here, does it show any of the administrative expenses? And that probably wouldn't be in this report.
It's not in this report.
Yeah, and I wouldn't expect it to be, honestly. But for if at $180,000, would it be best practice to do an audit?
We certainly can look at that. Part of what we have required now, as in the new contract, was bank statements. So that should help easily tie things back. So it's something I can discuss with the auditor's office, and we can look at that.
Right, I would want to do it. We should do enough oversight to know that we're actually performing oversight and not just assisting in, you know, creating a form for reporting, don't you think? We should at least decide what we're going to do about that. Chair Baker, I don't know if you have thoughts on that either.
Yeah, you know, I certainly am not going to be opposed to some kind of an audit, because this is really viewed as a department, in a, you know, kind of a standalone thing. And you're right, Ann, there really isn't any, you know, aren't any other that are similar to this, although we do have other programs that involve a lot more money than this, that, you know, we don't audit. You know, I'll just, you know, some of the programs that we provide support for organizations within Dubuque County. Some of them get, you know, some of them have been awarded more than this, and I don't, you know, I think we require them to submit a budget, and Stella, you can correct me if I'm wrong. They have to submit their budget with their request, but I don't know if we require an audit. And maybe you can, I think there's a certain threshold for organizations where they have to file. Some are not required to submit to an audit if they're under a certain threshold under the tax law. So maybe Stella can jump in and help with that. But do other organizations submit their annual audits?
So we have not asked Resources Unite to submit an audit. Under other programs, we ask for financial statements. Some of the things I'm thinking of are other funding sources, other organizations that we fund. We request financial statements and audits from, not just, this is reporting specific to this program. We haven't asked for any financial statements from Resources Unite as a whole, as far as I know. So that's something that we could also work into this as well, if you would like to see those.
Well, again, I'm just going to best practice, because we, you know, this program began and we're underway, you know, we're always underway, but is there a need, or is it kind of a difficult, I mean, maybe it's not needed for $180,000 if we feel that we're really getting our reporting back to be specific to what we want to know. You know, it's hard to create the system while you're literally in the system.
I guess maybe Josh Jasper can weigh in on this, but I'm assuming that they do get an audit. I don't know if it's if that's public information that could be submitted, and then we could get the information we need from that. That, you know, I guess I'm looking at an audit would be great, but for Resources Unite, this would just be a portion of their organizational business, I guess, or services. And I don't know if that can be segregated out. But if it's a public document, then it could just be submitted and we could try to glean the information with our in-house experts, Megan and Stella, to, you know, as a lower cost to hiring someone to do an audit, which is going to add cost to the program. But if we need to do that, you know, I certainly won't resist that. But
well, but I'm wondering, have we had the auditor's office? I mean, they're ultimately the folks we need to please. They make us hop through more hoops probably than anybody else. The auditor's office does for record, you know, the records we need to keep to comply with their standards. That's, I mean, that's the role they serve. Right now, their elections 24/7, but that's the role they serve for us. So, you know, maybe Stella, talk to Megan. We're going to have a new county auditor on board and see if we should be at least assuring ourselves. Again, I'm not trying to be difficult to Josh. He'll probably do anything we ask, but I don't know that we want to spend more money auditing $180,000. But we should at least be doing something. It's the only type of relationship we have like this with any entity.
I wouldn't recommend doing any external auditing. I would think that we could conduct internal audit functions if you would like to look at that.
I can just, yeah, make a recommendation for us, Stella. We don't have to decide it today. And obviously Supervisor Wickham's not here and he may have a thought as well. I don't want to burden anyone, but I want to be sure that we have transparency. Everyone on this meeting knows that folks ask us lots of questions about this relationship in particular. So we just want to bring our best to this and make sure we're building transparency in. And my guess is that, you know, and Josh, you can jump in any time, but I'm sure you want that too.
Yeah, absolutely. And to the point before, Supervisor McDonough, once Stella does that, we can certainly share anything from Eide Bailey, the folks that do all of our financial record keeping. So yeah, we're happy to obviously share any of that as well.
Yeah, I'm wondering even if there's a conversation, maybe Stella with Eide Bailey, if they look at this differently, or if Josh can ask them that, you know, do they look at this particular account with a different lens as they do their audit because it's public funds with public reporting?
We can certainly do that. And we can, I think it would be a good practice to actually get the prepared financial statements from Eide Bailey, if that's your preparer, just for our files and our review as part of the whole program.
Okay. Well, I'm glad that we do have, you know, a summary page for the quarter, and I appreciate that. And the bank statements, I don't think I need to see bank statements, honestly. Is this just for this account, Josh? This is just the general assistance account?
That's correct. Yep. So you also have all of the statements of the general assistance account at Tobacco.
Yeah.
For me, I appreciate getting the reports and the efforts that have been made. I agree with Supervisor McDonough that having the year-over-year look back would be helpful. When you know, we get to a point where we have we can do it by quarter. that would be helpful. It's probably going to be a little skewed right now with COVID, but and also, if I'm not mistaken, I was looking at the numbers. We did allocate almost 180,000, but I think there was almost, if I'm not mistaken, about 80,000 carried over from FY20. Is that correct, Stella?
That is correct. So if you look at that page down at the very bottom, that's $78,177. That would have been the balance of the funding. So the funding less the spending at the end of FY20. So as part of your contract that we just redid, Resources Unite's ending fund balance would come back to the county, just like any other department. So we need the board to verify that that is in fact what you want to happen. And then they would get their FY21 funding. So this would all be part of the closeout of the year end. So granted, this is the first year we're doing it, but hopefully in years following, this will all get reconciled within the July timeframe, right at the end of the fiscal year.
And what then, to do that, are you expecting Resources Unite to literally write us a check?
Yes.
And is that going to present a cash flow problem to them if we don't, I mean, have we released the funds for them for the current fiscal year?
We haven't. So the way we drew up that contract was that we would release the funding to them for the next fiscal year prior to them giving us the funding back for the end of their year.
So in theory, it presents a cash flow problem. We're putting them in a bind every year to do this.
We're doing it the opposite. So we're going to fund them with their next year cash flow before we get their ending balance back. Okay. So it should not create a cash flow problem.
Okay, that's important.
Designed it that way on purpose.
Okay. Well, I guess I would like to see those checks transfer, but I would like to make sure that we're not, you know, as we step through this in its unique position, if you don't mind doing that as the budget director, let's do that and make sure we're working with Resources Unite so they don't have a cash balance problem. That would be, that's crosswise with where we want to be, especially in COVID.
Sure. And Josh can address the first quarter of this year, but you can see if you've looked at these, the numbers are up significantly.
Right. My only, my other suggestion would be behind the funding summary, which we have up before us now, behind rent, for instance, you could put parens there, which would be, I guess, total cases or something. I know that it comes back on later, you know, it comes back later if you read through the detail. So maybe that's just something I'll have to do myself, but total applications approved. So for instance, in rent, in the case you have before us here, there were 54 funded rental claims for a total payout of $40,000. Correct? And then the same with utilities, that appears to be 43 utilities for a total payout of $22,000. Burial, if I'm in the right one here, it's 12. That can't be right. Just doesn't work. Is it 12 and there's $66,000? What's wrong here? What am I not reading right?
Sorry, Ann, which page are you on?
Well, I thought I was on the cover sheet, which was the application summary and the funding summary.
Of the fiscal year end or the first quarter?
I'm at the quarterly report dated September 30th.
Okay.
All you're showing in that first section is just how much money we've allocated. So I've got my math wrong. So the 50, if you look under the less, okay, we're not on that. The first cover page of the 930 report.
So the 930 report, there have been, let's see.
I think who's ever in charge of the spread, that the on-screen sharing would need to go back to the, correct, that is the page. So it's under the funding summary, the final set of numbers less total rental assistance granted. So that's 54 cases is what I'm saying. There were 54 applications for rental assistance granted in that time period.
Yes.
It's just a suggestion that we add there the total number. It would be interesting to be part of that, or that official cover sheet.
Okay.
My thoughts. Wow, 12 burials for $27,000. I mean, it gives you, do you see what I mean, Stella? It's on page 141. If we,
it's just in the detail.
Right. I know it's in the detail, but it makes to me the most concrete. If you're going to use summary form, that's where I'd like to see those numbers, because you can see how many cases were granted and then how much money have we spent for cases granted. Otherwise, you're just seeing how much money we've spent in summary.
Yep.
Detail's still helpful because it shows us how many applications were denied, withdrawn, and that's when you get to, you know, the appeals process.
Okay. Stella, would you, unless you have other explanations on the documents provided, I thought we could just have Josh Jasper do a report on the, you know, an update on the general assistance on both the utilities and rent assistance, as well as burials and cremations. And, you know, we had meeting last year with all of the funeral directors from throughout Dubuque County. And when we talk about 12 burials at 27,000, that would appear to fit in those guidelines, because I think that the maximum amount that's allocated is 3,300. I think 600 of that goes to the cemetery, and that leaves 2,700 up to 2,700, which in a normal setting doesn't really, that's a deeply discounted rate, but it's a no frills service that we provide as the last resort. So I'll go to let's have Josh perhaps do a walkthrough of the report.
Sure. Yeah, I think I'll probably just end up echoing much of what has been shared already from Stella and some feedback from supervisors. I think the first point I would want to reiterate, I like the year-to-year comparison. We've been doing that with the data that when we first started the general assistance program back in September of 19, we did get a document that showed month to month from the previous year. And that has been helpful for us to take a look at what was done the year prior. Now, of course, things are skewed with COVID-19, but it does help us see some patterns already, especially as things trend toward the end of the fiscal year, which means basically your April, May, June is specifically around utility and rental assistance support. And so I also would echo the point that Supervisor McDonough made. You know, maybe it wasn't a point, but simply an underscore of the burial assistance part of this. And I'm not alluding to, you know, hey, we need to revisit the conversation of do we limit or reduce, but more so of just being mindful, I suppose, and if there's a better or different way that we budget. Because if you're not careful, much like you'll see in the report in this first fiscal year, was, you know, we had to get an additional pot of money specifically for burial just to make sure that we didn't run out. And so I don't have the answer there, but I do think it's important for us to continue that conversation.
Right, Josh, and I would add on the burial, to the burial point, and when I say we have a burial problem, I mean, we kind of do. Because when you look at like the data walk, which I know you participated in submitting information to the Community Foundation, and you see them put that number up on the color-coded graphs, and you look at the burial expense, still, and that's our money, right? That's the general assistance flowing through Resources Unite. I don't know of any other nonprofit that's paying for burial expense except the county. And you see that on its grid and its color form, and burial just stands out as shockingly more money being spent on burial expenses in Dubuque County than on any other level of human services. So it's concerning, and I don't know if you have a thought about how we get a better handle on that. That might be something we'd have to look at again and again, but maybe we don't have a burial problem so much as we have a human services problem. Maybe we need to change it and talk about it upside down. But folks being, other counties only give a much smaller cash assistance to burial, and then they walk away. They say $1,000 and they're done. And everybody can come up with, however they're going to make that happen. But I appreciate anyway you're submitting information to the data walk. I'm glad that you're a participant in that, so the county numbers are reflected inside your numbers.
Absolutely, yeah, and I think it is an ongoing conversation. And as I said, I'm not coming from a place of having an answer on behalf of Resources Unite, but I think that's an interesting point to maybe it's a different shift. It's more of a human services issue, and maybe that translates into priorities might not be the right word, but more so of where is the focus under this heading of human resources for the county. Mm-hmm. And so the other thing that I think has come up that Stella mentioned before, as you can imagine, numbers are significantly higher in regards to applications, specifically in the categories of rent and utility assistance. And, it continues to be so. And so one of the things that I'm sure the county supervisors are aware that there is the CDC eviction moratorium that's happening from now through December 31st. But that presents a significant problem, as you can imagine, come January. One of the things, though, connected to that is we are finding that it's not a moratorium much like what Governor Reynolds had previously, where you find within the court system that it's not, the same decisions aren't being made, meaning people are still being evicted. And so I'm trying to get some more information from some of those folks making those decisions, some of the judges, as to, I think there's some differing opinions of what that CDC moratorium means.
And Josh, I would direct you, if we can maybe have Ed Rayburn jump in here if he's still somewhere, and I see him there, but he may be away or on the phone. But Ed's done some good work compiling FED, which are the eviction filings. He has created some good data, and it's year over year, isn't it, Ed? And I don't know if we've shared that with Josh, but it would be given a way to put some framework into. It doesn't appear more people are being evicted or more papers are being filed for eviction. So maybe, we're holding our own, so to speak. I think the funds are going to run out, but Ed, do you have anything to add to this point?
Josh, this is Ed. So working through our local court, clerk of court, and then grabbing some data from the state, we did get a collection of information, and the clerk of court has been very helpful to try to figure out some way that to get some interesting information to us. So I have been talking a little bit last week with Alex Baum from the Community Foundation. He had the data walk last week, but some of it needs a little bit of going through that data. So because it was just a data dump. So we're needing to do a little processing before we can figure out what that means. But certainly you or somebody in the very near future, whether that's the end of this week or beginning of next week, once we kind of grind through that, I would be very interested in giving that to you, going through that with you to see what sort of things you see in that. We're not going to be the ones that understand all the data. We're going to be wanting to share that a little bit to see what a variety of partners in the community can help us understand about what's going on. So
yeah, that'd be great. Yeah, definitely. Yeah. Let me know. I'd love to continue that conversation. The other thing that I would point out to the county supervisors connected to this that I think it's important that it doesn't include in the data when you look at evictions, and maybe this will come on this conversation, Ed, but what you find is many landlords in our community continue to unethically use eviction. And so there's a lot of scare tactics, and it's not with all landlords, but we have a lot of people weekly come in, and I feel like we are reiterating simply law, and that where it's like, no, your landlord can't come to you today and tell you to be out tomorrow. And so I think in that conversation of eviction, it's important because although you might not see from the county perspective X amount of evictions per month, you still have people that quote unquote are evicted, meaning it just simply didn't go through the court system, where Susie, single mom of 3, was pressed by the landlord and was fearful and was like, all right, fine, I'm going to leave Monday, because the landlord said the sheriff's going to show up. And so that is a very consistent pattern within our community, and not just within the city, that I think is important, a part of this conversation as well.
And that's interesting too, Josh, because just to make a connection here, but Iowa Legal Aid, which is of course the attorneys, they have not reported to me that they've had this soaring number of calls coming to them about the things you're talking about. It might be that Resources Unite is, well, you're clearly dealing with questions that otherwise would have come to Iowa Legal Aid or otherwise would not ever have been answered, that you're kind of becoming the frontline face of folks facing eviction. And so,
well,
how do we work together?
Yeah, there's a lot of referral to legal aid. That's probably the top 3 referrals that we're writing down for folks on the referral sheet when we give that to them. Now, whether or not they're consulting, but I think the other part of it that's important is the hypothetical Susie is coming to our office, and I don't have the percentages, but at least 50% of the time after she has, evicted. So meaning she's coming in and saying, okay, so like a family today, for example, I'm in the days in with my 3 kids, I've got till Wednesday, and then my money runs out because I was evicted. And then when you have that conversation of like, okay, so what does evicted mean? And because that's important, because, okay, did you actually receive notice? What did that look like? And more often than not, it's not. Where with, yep, I went to court, and all that kind of thing. And so that's a part of what I hope we can have that conversation with as well, Ed, with that data.
Yeah, good point. I appreciate that you're really seeing those things and you're seeing that as trend and that you're aware. So thank you for that. That's an important role that you're serving. And I don't like the numbers of landlords. I mean, you truly have it if you go through some more of the pages where you say the landlord refused to accept. That concerns me. Again, in a perfect world, I would have demographics being maintained, like, are those landlords in any way reflect race relations in refusal to accept rental, our assistance? Because those are things that concern me greatly, and I think we need to ask that question at every opportunity. Do we have equity and also equal housing? So, but I don't know if you're collecting that. At one point, I think you had hoped to do that, but I don't know in the overall sea of what you're, literally the volume of what you're having happen, if you've been able to keep any kind of demographic statistics.
We do have all of that, and already we see patterns, to your point, Supervisor McDonough, of specifically actual particular landlords, and then you start to see a common script, so to speak, of stereotypical tenant, of what that actually looks like. And so, because what happens is, even in this report that you see where, say, landlord denied support, much of what that actually looks like is Katie, for example, within our office, calling the landlord 8 times and saying, hey, you have that release, can we get that from you? And they're simply not responding until the eviction passes. And so there's that piece as well. So that we're trying to, help the landlords in a way to be more responsive, but then to even better understand, like, hey, let's how do we help you more effectively before you would, in your mind, deem this tenant someone that you just want to be off your property?
Yeah. And your denied application data in the form that you submit for us, so the one you turn in, which got the RU on it, right?
Yes.
As compared to the one that I'm seeing before me, there isn't that narrative. The narrative is not transferring. So Stella, I guess, note to us, what we want to see in our report being, I want to see that information about denied rental applications. I highlight, the gambling issue, and then the landlord wouldn't accept. Both of those are concerns. So maybe on the landlord wouldn't accept, the connection to the Human Rights Commission at the city of Dubuque to see if we're providing information that we're gathering about who the landlords might be and context for this. Sounds like, I don't know if you're doing that, or if, what time staffing allows for, but I would hope someone's following that as well.
We definitely are. Yeah, we are in regular contact with Kelly and her office.
Okay, good.
Referring people.
Good. And then the gambling issue, I'd like to have you say that again so we all understand as best we can why gambling is the basis for denial. I understand if someone won a bunch of money, that would be of concern to me, as well as if they lost a bunch of money and then they're here before general assistance. But why are people being denied for gambling?
Yeah, I mean, for us, it's simply one of the county rules where when we send the releases to the casino, and as a reminder for the supervisors, it's no longer being sent to the Diamond Joe per that previous conversation. So the data is now just simply from the Q casino. And so release going out to them. And then I think it's important to note too, because objectively it's a flawed process, because what we're really only asking is, do they have a player's card? Because there's no way the casino could know if a person went in and just spent $10 on a slot machine. And so what they're sending us back is if someone actually registered and became whatever that might be called at a casino. But yeah, that's just the rule from the county, and we're abiding by it.
Do you know, Josh, if other counties that have, we're not checking out to see how they're doing on the boat up in Marquette, are we?
No. Right. Yeah. And I certainly could. Yeah.
Oh, don't. I don't want you checking other places on this issue.
No, I mean, I thought you were asking, do other general assistance programs send releases to the casinos?
Maybe what we should do, and Ed, I don't know if you want to do this, and Josh, I just wonder if, anyway, my thought was to say, if you've got 3 burning questions that maybe Ed's had a good way of tracking down data for us that otherwise has been not available to the county, maybe some of those contacts can be made. He has asked me several times to look at resources, to look at general assistance from a broader perspective. Are we ready to do that? Not to look at you, but to look at the process and the whole program of where we are. But that might be something. I don't think someone should be denied their ability to apply for general assistance because they once had a player's card at a casino. I have one. Am I a player? No.
Well, and I think what's important there, and I mean, as you know, there is the Section J that has discretionary power for me, the director, to make those decisions, but I don't with that gambling piece. But to maybe even just amend at some point that, because there are a fair amount of folks, I think there's 2 important pieces here. There's a fair amount of folks that are denied because, Susie gambled 3 years ago and spent $47, and that came back on a player's card. And I think it's important, and again, this may be the 30,000 feet conversation that you're referring to with Ed, but we're penalizing people after the fact a decision has been made by them. And so it's not as if Susie knew by going to the casino that she no longer could ever receive support from the county. And so that seems a bit backwards. And now I will tell you, just in the last 3 months, there's value in doing that. We had a release come back and a person had $36,000 on a playing card. And so it was like, okay. And now in investigating that a little bit more, that person won, and of course, put it all back into the casino. But, you know, we certainly do get information back where it's like, okay, you know, that's probably not someone, but even that, and the last point that I would make with that is what we've been doing with those folks, if when interested, is then, hey, we'd love to refer you to consumer credit counseling that provides you free budgeting and getting you thinking more about just, okay, if you have a budget of, you know, $2,000 a month in income, let's talk about where priorities are, and does the casino fall in the top 4? And so some folks have actually been following through with that, but I think there's opportunity there, back to that 30,000 foot conversation.
Yeah, well, when, you know, this isn't, I mean, if Supervisor Wickham was here, we wouldn't be having the 30,000 foot conversation, I don't think. But if we, and I don't know that this is the time or place, I'm genuinely interested in that. I find it interesting to see what you are turning up now that you've done this enough, that you've seen general assistance and you seem very comfortable in this role. I think you know what it is you're doing here, and I think it would be, there's value to sharing this with community partners as well, and also getting feedback from them. You know, when I look at general assistance and I note that your funds are running dramatically low in some categories, the county has also placed $400,000 into the COAD fund at the community foundation. So, you know, we have tried to be a significant, and rightly so, a significant community partner in addressing the needs of our citizens during COVID times. So, but before I want to ask just another question, if you can, Josh, I know you are of the county, so to speak, that you born, raised, and live in one of our smaller communities in the county. Do you see applications coming countywide, or is this primarily the city of Dubuque? I mean, I don't want to do a zip code analysis, but what's your kind of feel about this?
We certainly see a lot more since when we started. It most definitely was very city-centric. And certainly the majority of applications are from the city of Dubuque. I think it's, I mean, this is my bias. I think it's an improvement when we're getting more within the county. And so specifically, we're receiving more applications in order, Cascade, Dyersville, and Holy Cross, like even per capita. And so, and some of the stuff that we've been looking at patterns, though, of course, you would, if you overlay, and this is a generalization, but if you overlay where then higher county housing is, you're going to find potentially more of those individuals that would apply for general assistance. So, and a lot of that is, I think, what we're doing when we do a lot of our outreach events from food pantries and things like that within the county, we're also then including information about the general assistance program, and that's helped. And so a lot of people in the county had no idea that they would be eligible for such resources. And so it's improved, but I don't think it's there yet.
Mm-hmm. Okay, well, thank you. That's great to know, and I appreciate the feedback. Good information.
Yeah, Josh, Dave Baker, I just had kind of looking for an update. When we made the decision to have Resources Unite take over this program, there were two things that really were helped sway my decision. The first was your pledge that your organization would look at connecting people with wraparound services within your organization and other organizations. And I kind of wanted to get a feel from you about, you know, of the folks that you're serving, what percentage are you connecting with other organizations that might be, you know, instead of getting county taxpayer dollars, might be getting help in other areas. And then the other side of it, which you don't need to comment on, was we have a really great Veterans Affairs Department, and of course they're the commissioners of Veterans Affairs. provide great services for our veterans, and we wanted to free them up to provide additional value-added services for our veterans. So, but I don't expect you to comment on that. But on the wraparound and connecting folks, I'd like you to at least comment on that.
Yeah, absolutely, Supervisor Baker. 2 points, really. Number one, I mean, 100% sounds maybe a little grandiose, but it's near 100% in regards to connecting people. If someone presents here and is applying for rent or utility assistance, it's near 100% that they're being referred to other organizations. What excites me most, and it'd be a weird frame to say, there's been a really good positive thing out of all things this pandemic, and one of which has been specifically in the rent category with a much stronger collaboration with the other organizations. Like, we are almost daily, if not every other day, having conversations with those organizations. I was down at St. Vincent de Paul a few weeks ago to do a little training for their team, just to for them to better understand general assistance, but more so of what we're trying to accomplish long term, and then learning about them and what they're doing as well. And so that has significantly improved from our perspective. And so, and because a lot of the conversation honestly sounds like, how do we all better work, not only collaboratively, but then in our own lanes more effectively? So for example, and this is to minimize it, but you know, we have a lot of folks on a daily basis that are looking for deposits. That's a big issue in our community. Well, now, there's a couple, but at the end of the day, Jim Munson is the deposit game in our community. Like at Hillcrest Services, he is the number one. And so in all of this pandemic process, what we've done is, you know, I've specifically told Jim, I said, look, you have to make sure you're sending people here first so that you're not expending what is a relatively small amount of money in that deposit pot of money for us to take a look at it first. Now, we, as you know, can't do deposit, but there's oftentimes other things connected to that we can support. And so it has been really positive in that way. And actually, St. Vincent de Paul and Resources United are working on a data sharing system, which has really been one of our long-term goals as an organization, really even outside of general assistance, and getting their team trained specifically on some of the things that we're doing. And so that's maybe a long answer, Supervisor Baker, but that's been a really positive thing. One, referring people to other organizations, but then two, making sure that we're maximizing all the different resources in the county.
Thank you for that, Josh. Supervisor McDonough, any other questions for Josh Gasper?
I guess last one. Josh, your utility balance is only $5,700. You've spent over $16,000 paying utility assistance. I know the moratorium is in place, or for the shut-offs. What is your thought about that? I know you're not here asking for funding today, but what's your anticipated way forward?
Well, I mean, so right now, which this report doesn't reflect, we have about, and Stella and Don and I have been talking pretty consistently about, we're sitting on about $15,000 remaining. So as I've shared with both of them, once we get down to 10 or 15,000, we need to make sure that you all know, so that that first installment for the fiscal year comes in, because as we know, a couple of burials can put me down to zero pretty quickly. The trend is continuing to go up with utility assistance. You know, I will say it's encouraging that we have other programs, so to speak, that didn't exist prior to. So for example, Ed shared some great information recently about the Utility Prevention Fund that the state of Iowa is supporting. Now with that though, it comes issues, right? Where when you look at, for example, the city and the rental assistance program that they've been doing, of all of the applicants, and I don't remember the numbers, hundreds, I think 5 or 6 or whatever ended up being funded because it's rigorous. And when you look at how to qualify, it almost immediately disqualifies the stereotypical folks that we're serving for a couple of different reasons. And with that other utility prevention fund, it's not the easiest. You know, there's some assumptions there connected to privilege where it's like, okay, I'm going to go home now and get in front of my computer and fill out this form. which that's just not real for many folks. And granted, there is an 800 number that people can call. But it's one of those things, and this is what we face every day, is how do you more effectively get the services to the people in need when you're living in a studio apartment and don't have the internet, don't have a computer, and you're about ready to get pushed out. And so that's probably a rambling of your question, but it's continuing to increase. Again, I think it's been a great conversation and partnership increasingly with Operation New View / HACAP, and really knowing, like, for example, what Stacy's able to do with a certain person with utility assistance and other folks. But this is going to continue, and we know the trends of the general assistance program, where specifically May is really a lot of the money that is spent, right? And so we know that COVID minus, and so.
Right. So when you said there is $15,000 left, I don't understand that.
So right now in the general assistance account, there's approximately $15,000. So we're operating off of last year's fiscal year and the COVID money that was, and so without that, the new fiscal year funds. And so that's what's remaining currently in that account.
Right. I understand what you're saying. It's the cash flow with the transfer of the 2 years, but the balances that are reported here before us as of September 30th for the quarterly report, that's what I was showing concern, that there was only $5,000 remaining there. So
I think we need to, this is Stella, I think we need to talk about that quick though, because the way the contract reads is that I will distribute in equal amounts 2 installments to Resources Unite. So we'll be distributing the first installment, which would be $64,000 in total, but we're going to be requesting back the $78,000, correct? The year-end fund balance?
I thought it was $20,000 year-end fund balance.
20,000. I'm not sure
where are you finding a $78,000 year-end balance?
That would have been at June 30th. So if you look at the June,
hasn't Resources Unite been operating on that those carryover funds?
Yes, they've been operating on that because we haven't closed out the year end. So
right.
Theoretically, we would distribute 1/2 of the 2020 balance. So that would be 64,000, and they would distribute back to us the year-end fund balance of 78,000.
Well, that doesn't work, obviously.
Right. So that's why I bring this up now. How we want to handle that. Do we want to distribute more of the FY21 allocation at this point?
Josh, what do you want to do?
My number one, I want to get clean with, because I don't like how it's messy where it's the previous fiscal year and then you have COVID on top of it in the same account. It creates anxiety for me. And so I'd like to, and this is me being very simple, but like when I think about like, okay, so if Stella gives me $64,000 to put into the general assistance account today, then okay, I will write a check to zero out what's in there today back to the county to then zero out the last fiscal year plus COVID, which technically is just COVID money, if you look at it that way. So then really when that 64K comes in, we're starting at simply there is $64,000 in that account. But I don't know if that makes sense. Stella, you're obviously better than I am about
this. This is where I would like to be. I would like to, Stella, make the distribution to Josh that makes sense between you and Josh. Okay? Because no matter what, I mean, we have had more passage of time here, and I'm sure he's paid big claims since September 30th. We're like, what's today? I don't know, 12, 13. I mean, that's 2 more weeks in the amount of expenditures that we've had. I think we should distribute what's necessary to, we know there's not going to be enough money in the general assistance account to do 120 and think that's going to last until June 30th.
With the board's permission, I can distribute the entire FY21 allocation now. At this point, it would be distributed in about 6 or 8 weeks anyway. So this would be slightly early.
That makes to me the most sense. So we get this closed and reset, and then Josh is going to have those two accounts understand we have a balance and we agree upon the numbers. I think that makes the most sense to me. I don't, if that, I'm glad to hear it makes sense to you, Stella. And then I don't know what we're going to do in terms of we're going to be out of funding. Obviously, we're going to be looking at a budget amendment, but it really goes to a deeper conversation between partnerships too, with the money that, and is any way left at the community foundation? Are we expecting any of that to be spent with Resources Unite to any of these goals? Rental assistance, the county has, I think, done a tremendous job of standing up for citizens. When you look at the combined general assistance budget that is every year that we have, and additional dollars that we put into the community disaster relief fund. So I don't think we're shirking our responsibility. It's just not all showing up in this ledger sheet, Josh.
Yes, and so maybe 2 points. I just want to make sure I understand the first. And so when, Stella, you make that distribution, on that day, am I then writing a check for whatever is available, or is that staying in the general assistance account?
So you would be writing a check back for the June 30th year-end fund balance.
And just, again, because I want to make sure I understand. So again, what is remaining in that account? Because it's, as we know, it's that fiscal year and the COVID money. So as I said, right now it's $13,510.
No, so it would be for the whole 78,000. So that's what would have been at June 30th, the ending fund balance.
Right.
Oh, I see.
And that's what I think, I really would like to have the two of you work that through to make sure. My priority is cash balance and cash flow as well. And we might need to, maybe we should be at a point where we're asking for a budget amendment for general assistance. And the COVID money being involved in that too, Stella. I'm not exactly clear on what Josh means by that, but I think the two of you can work through that. I'm okay with releasing the full annual allocation.
And to the other point, if the supervisors would like, in transparency, we've applied twice to the community foundation to that fund, and to a total of $30,000. And so it was specifically on supplies, basically, emergency things for folks. And so we certainly could do that at some point as well. I could, I don't feel like we've really expended much, through that. And so if at some point the Board of Supervisors wants me to submit a request again, I can certainly do that there.
But the request that you've had previously has been for supplies, as you say, not for rent, utilities, or
That's
burial, correct?
That's correct.
Right. And I don't know who else is paying for rental assistance. I mean, lots of organizations are, as you say, through Jim Munson. There are a lot of folks with their shoulder to that wheel trying to keep people in their housing. It's not just the county.
Correct.
There's a lot of money being spent toward that, and this doesn't even look at, food all that much compared to what you're spending through St. Stephen's. And none of these records in and of themselves reflect the true nature of the depth of the need in the community. There's not a comprehensive document that shows that.
That is correct.
Okay, it sounds like Josh and Stella will need to get together and get back to us at a future meeting. And any other questions, Supervisor McDonough?
I don't. Josh, I'm going to give you the final word. Do you have something else you want to say?
The one thing, to your point, Supervisor McDonough, and I would actually enjoy doing this, I think it would be helpful, is to create such a report that you are referring to. And so I'm envisioning reaching out to those other organizations and saying, okay, so let's take a look at the amount of money you're expending in these different categories. We can put it all together. And so maybe I would just ask the supervisors if there are specific things that you would like to see on this community-wide report that we could start reaching out to those organizations to see such a more comprehensive. And that would, I think, be helpful to see other categories such as food. I mean, we do the every other week with Jason at the Community Foundation, we have these calls, but we're really not looking at data in that way as to, like today, for example, we gave out, if I look out my window, I think it's all gone now, but probably 4,000 pounds of food this morning already. But then, you know, Teresa's doing a fair amount, and then you even look at the convivium. There's a lot of different things going on that we're just not tying together. And so if, you know, if the supervisors have any feedback to that, if you want to email me like, hey, let's take a look at these categories, you know, things like that, I can start putting that together.
I'm interested I am interested in such a report, but I don't know that I don't know who's the person to put that together. I don't know who that is, who's got all that, who's got the data, the access to the data quickly, and then also who's got the support team to do that. Because I think that's going to be combing through a lot of information and then asking, who did we still miss? You know, who's serving the needs of the minority, the immigrant community, the refugee families that are, you know, all flying below scope. How many pounds there, or what's the dollar value there? So anyway, I think I'm interested in that document, but I'm not going to ask you to do it because I think it takes the prioritization of all your other tasks. Josh, I mean, you deserve a day off too.
Okay. Well, as always, just open to feedback.
I know. Thank you.
Thank you, Josh.
This is Stella. I just want to jump in one more time and clarify that I have the direction of the board to pay the full FY21 allocation at this time.
You do from me.
Okay.
Yeah, that seems to make the most sense
okay.
at this point, Stella. So
perfect. Thank you.
And then Stella, there'll be at some point perhaps a budget amendment going forward.
I would anticipate that there would likely be an amendment for general assistance.
Okay, thank you. All right, anything else? Otherwise, would entertain a motion to recess as our next meeting will be is other than our regular Board of Supervisor meeting. So I think a recess is in order, unless Mary Hobble kicks me and tells me different.
Well, my thought, the parting comment to Josh is thank you, honestly, on behalf of the supervisors and the community. Thank you for being there and growing into this position with us. So I just want to say that it's, I don't want to make light of the amount of work that you do, but I'm happy to do a motion to recess.
Thank you.
And I'll second that. And Josh, I thank you as well. And I think working with Stella and getting these reports fine-tuned is a good step for transparency purposes. So, all right, motion was made and seconded to recess. All in favor signify by saying aye.
Aye.
Aye. Carried 2-0. I do want to point out for those that came on later that Supervisor Wickham's aunt passed away and he was at a funeral today. He did start the meeting with us and then had to excuse himself. So anyway, have a great day and everyone be well.